Good morning, everyone. I'd like to call this meeting to order of the Community and Health Services Committee meeting for April the 9th. Today, we're going to be hearing from several delegations on the plan to end chronic homelessness, and we'll also be in a presentation, and we'll also be hearing from staff on creating culturally responsive not-for-profit childcare spaces. To begin, I'd like to call on Julie Hale, the committee clerk, to conduct the roll call.
Regional Chair Redmond.
Present.
Councillor Craig.
Present.
Councillor Deutschman.
Present.
Chair Erb.
Present.
Councillor Foxton.
Present.
Councillor Harris.
Present.
Councillor Hunick.
Present.
Councillor James.
Present.
Councillor Liggett.
Present.
Councillor McCabe. Councillor Nowak. Councillor Salonen. Councillor Shantz. Oh, we just got a note. She's on her way. Thank you. Councillor Verbanovich. Thank you. Councillor Williams.
Present.
And Councillor Wolf.
Present.
Thank you. As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is the traditional territory of the Haudenosaunee, the Anishinaabe, and Shlonaton peoples. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise and the challenge of truth and reconciliation real and intentional in our region. Are there any conflicts of interest under the Municipal Conflict of Interest Act? None. We have no presentations. We have a number of delegations today, and looking forward to hearing you and having you here. Thank you for being present. However, before we hear from the delegations, I'd like to remind my colleagues that questions, especially considering the number we have today, to be directed to the delegations, and that staff will be speaking about these matters later in the agenda with a formal presentation on the plan to end chronic homelessness. As a reminder to those who are delegates, some guidelines for your participation. If you conduct yourself in any of the following manners, it will result in an immediate removal from the meeting, interrupting councillors, staff, or other delegations, derogatory statements about councillors, staff, or others. If you're online, turning your camera on and off at inappropriate times, and hate speech or defamatory comments. And one last reminder to delegations, please don't take any offense if following your presentation there are no questions from council. If your presentation probably hit the mark, there would be no reason for any questions to be asked. This is council's time to listen and reflect upon the opinions and ideas shared with us from our community members. We're grateful for all the work that has been done by the community and staff on the plan to end chronic homelessness, especially for the work accomplished by our co-creators. And on behalf of my colleagues in council, I'd like to thank all of the delegations for speaking today. And to my colleagues on council, being reminded of the number of delegations that we have to keep our questions focused, not too much editorializing or comments being made. We've been made aware that there's a minor accident on 85 Highway, which is delaying some people getting here on time, and I think it is impacting our first delegation of Julie Walder, Tracy Elop, and they're all here now? You're all, okay, so we're here, okay, sorry. All right, so we'll begin our delegations, and first I'd like to call Julie Walder, Tracy Elop, and Jen Holbrook to present. And you have 5 minutes between the three of you.
Excellent, thank you. Good morning. Let's try again. As participants in the co-creators group for the Plan to End Chronic Homelessness, we want to formally support the recommendations. We appreciate the community-driven approach informed by those with lived experience, and we believe that young parents who are facing homelessness and struggling with parenting and meeting the basic needs of their children are not there because of bad luck or poor choices. They're parents who have faced significant challenges and need their community to support them. This morning, we want to share with you how we, a collaborative of 3 organizations, plan to address the needs of young parents, parenting in crisis, and the many who face homelessness. Our project has been endorsed in principle as part of the Plan to End Chronic Homelessness. Next slide, please. Do you remember the joy, love, and happiness as you welcomed a new baby into your family? Along with the joy comes countless sleepless nights, a fear of not knowing what to do, unexpected expenses. That is when most parents turn to family and friends for support. Unfortunately, not every young mother or young mother-to-be has a healthy family or circle of support to turn to.
Just imagine that you're an international student, alone in Canada and pregnant. You don't qualify for OHIP, so you give birth to your baby alone in your apartment. Or imagine you're the mother of a two-month-old. You don't talk to your mom anymore because she's struggling with her own complex challenges. There's no one to call when your baby will not stop crying. You think about telling your doctor, but you're afraid she'll call CAS and have your baby taken away. So you're alone and afraid. Imagine to protect your unborn child from abuse, you finally gather the courage to leave an abusive partner. You have a decent paying job and a car, but you have no place to live because you can't afford market rent on maternity benefits. These are the stories of the young parents we work with. We are 3 organizations who provide services to young parents and their children. Marillac provides transitional shelter services to pregnant and parenting women in Kitchener. Camino specializes in well-being and mental health and operates live-in and second-stage housing, outreach, and day treatment support for young parents and their children. The Pregnancy Center provides crisis support, such as help with basic supplies, counseling, and mentoring to parents.
The need for support for young parents is rapidly growing in our community. The Pregnancy Center provides basic supplies like diapers, formula, and wipes each month to over 500 families. These numbers grow every month. Marillac Place is at capacity with a wait list. Every month, Marillac Place turns moms away who don't qualify for our services because they have more than one child or their child is over 2 years old. With a maximum stay of 1 year, many moms and children leave Marillac Place only to be re-traumatized by having to return to live in unsafe conditions. Only 2 of 17 moms who left the program last year were able to find and afford market housing. Moms find themselves in temporary spaces like hotels, family shelters, or a friend's couch. Camino has seen an increase in parental stress and poor mental health. There is growing evidence that children are impacted. The Ontario Association for Young Parent Agencies reported that 58% of children of parents receiving their services have speech delays by 18 months. Our plan, next slide please, our plan is a one-stop hub that would increase the supply of much-needed shelter and second-stage housing spaces. This project is focused on prevention, healthier pregnancies, healthier children who meet their milestones, improving safety for moms and their children, and making it easier for parents to connect to a range of professional and community supports. These supports are designed to assist parents in meeting their goals and successfully transitioning to independence. In addition to housing, our plan includes an on-site school program for the parents, daycare, childminding, respite, counseling, and employment support. We have been meeting with community partners and local politicians and receiving great support for our plan. We are in the beginning stages and need to raise approximately $500,000 to qualify for government seed money through the Canadian Mortgage and Housing Corporation. Our plan will require an investment from all levels of government and from our broader community. We hope you will also support our vision of a community that supports vulnerable young parents, because we believe children have a right to be raised by stable and healthy parents, and when parents are supported, they can provide the love and care that children need.
Thank you. I see we have a couple questions. Councillor Deutschman.
Thank you, Chair Erb. I just wanted to clarify at the start of the presentation, first of all, thank you for coming in this morning and for all the work you do in the community. Much appreciated. Much appreciated seems so underwhelming to say, but it's super appreciated. I just wanted to, your initial statement was you support how your plan is incorporated into the plan to end chronic homelessness. And can you provide some details? I'm not sure what exactly you meant by that. That was the first speaker. Pretty well the first sentence.
Hi, thank you for the question. Through the fee for service proposal that was put out to the community last fall, Marillac Place submitted a two-part proposal, one to increase our baseline supports so that we would move out of an operating at-risk designation where we were, and the second one was a proposal for a capital expense. So this is one of the two capital projects that were endorsed in principle by council.
So just to clarify, that's part of the fee for service, which was previously approved. It's not specifically stated in this document that's in front of us today. I'm just trying to understand, because you say you support the plan to end chronic homelessness, I'm just trying to, I apologize. I'm just trying to understand our plan. And when I hear that comment, I just needed some clarification.
Sorry, I think what you're asking is that all of our three organizations are part of the consulting table in the community with the plan to end chronic homelessness. So we participate with the co-creators group.
Right. So there's no specific plan, though, within this document.
This is just a very broad overview, all we could say in 5 minutes, of how we're contributing to the plan to end chronic homelessness.
Thank you. I think you've answered my question for me. Thank you.
Councillor Wolf.
Through you, Mr. Chair. Again, thank you very much for your presentation and the services that are so much needed that you provide. I'm curious to know if, I know you're situated in Kitchener, but do you provide services to women in Cambridge, or is there other places that women in Cambridge can go?
So Camino's second stage housing is in Cambridge right now.
Okay. And the other services?
I think, right now Marillac and the Pregnancy Center are located in Kitchener. I think as we look at this Young Parents Hub, we'll be looking at how we can serve the whole region, whether that's scattered sites. We haven't come up with the final plan yet, and that's one of the reasons we need the money to get this off the ground.
Okay, thank you, and I hope you get it.
Councillor Foxton.
Thank you, and through you, Chair. Just to clarify, so when Councillor Deutschman asked the question, you said that there was some capital funding that was coming out of the plan for homelessness. Well, is there any capital funding going towards this project from the region?
I'm going to ask Commissioner Sweeney to speak to that.
Yeah, maybe I can help clarify. So the plan to end chronic homelessness that is before you today does not have any specific organizational program-specific funding allocations in it. The fee for service proposal that Marillac put forward back in the fall was endorsed by staff and by council in principle on the idea that a location needed to be sourced. So we have committed to working with the group here to figure that out going forward. But as we get into the plan to end chronic homelessness, there isn't a specific budget ask for specific line items. We've used everything we know in the community and the needs and gaps, but there's nothing specific in that for you today.
Thank you very much.
Okay.
Councillor James.
Thank you. Through you, Chair Erb. Thank you for coming in today. I just have a question just regarding the trends you're seeing with women, those who are pregnant, having children, trends around the urgency for homes and transitional housing. It just speak to kind of some of the numbers. I'm thinking kind of 2020 to now, high level, nothing in particular, not you don't have to have the concrete, but just what have you been navigating as a result, especially with women and children and those who are pregnant?
So the demographic is changing for the women that are reaching out for support. These programs were developed 40, 50, 60, 70 years ago, and essentially were created to be homes for mothers who are pregnant. They leave their communities, they come and they have their babies, and then they go back to their families and their communities. That's not what we're seeing anymore. What we're seeing is women who are 18, 19, 20, all the way to 26, who are pregnant. They have low-paying jobs, and there's nowhere for them to go. Since COVID began, the housing crisis, the spike in housing crisis, if they're on any sort of fixed income, there's just nowhere for them to go. So what we're seeing is an increase in acuity. So we have women that are coming with very complex issues, physical and mental health issues, as well as individuals from different demographics. So we are supporting women that are on maternity benefits, that have full-time jobs and have cars. They just can't afford to live anywhere. So it's we've been running at 100% since the end of 2022.
Thank you very much.
With a waiting list, I should say.
Thank you.
Those are all the questions. Thank you. Our next delegation is Shelley Campanola. Shelley, are you here? There you are. You have 5 minutes.
Thank you. Good morning. My name is Shelley Campanola. I'm the Executive Director of Compass Refugee Center. Thank you, Chair Redmond and regional councillors, for the opportunity to present to you today. I come today to speak to the plan to end chronic homelessness, to endorse it as a good plan. It is also, though, an ambitious plan with the goal of ending chronic homelessness by 2030, just 6 years from now. With population growth over that time period expected to be 84,000 more people, we can expect, I hope, that a proportion of that growth will include people at risk of becoming homeless. I say I hope, not because I want them to become homeless, but because I want us to recognize there's that possibility. To bring it down to size, that population growth works out to just under 270 new people a week over these next 6 years. The plan is also a comprehensive plan that Compass was involved in as a co-creator, addressing several groups of people particularly challenged to find and retain what I will call home. It's not just about getting a roof over your head. The plan recognizes that such challenge is immersed in these people being most likely to be pushed to or kept in the margins where they cannot experience what those not in the margins do. The primary goal of the plan is to shift from a reactive and emergency-based approach to an upstream approach that is preventative, human rights-based, and equity-based. This means a lot to Compass, who works with people from over 80 different countries. The plan's success will be dependent on a few key things. One, political will. This must be deep and unwavering, surviving the coming elections. Courage to collaborate. This will mean moving from controlling the systems to sharing and receiving in new ways the resources and expertise that this community has to offer. I have learned that it is like making a cake. Everyone brings their ingredients in all different measures and lets go so they can be mixed together to create something everyone can enjoy. It also means no one can see their one ingredient in the outcome or take their ingredient away if they don't like how it turned out. It is an all-in approach. It will be dependent on a commitment to community. This is not just about ending homelessness. It is about ending displacement and placelessness. The authors of Beyond Homelessness in 2008 wrote about how we have created a culture of displacement whereas home is a matter of community. Home is a matter of undoing social, economic, psychological, legal, and geographic displacement. Home is about having a place where people can establish homemaking, and it closes the loop in homecoming. It is essentially about inclusion, not exclusion. The plan's success will be dependent on there always being a place for someone to go to and room for new people to come to. This last point is critical because we cannot allow the preventative plans to become exclusionary plans in order to meet the goal, not letting people in so they are not counted against success. The idea of no one left behind cannot be reduced to no one let in. I was in a meeting recently during which it was noted that refugee claimants, the primary group of people that Compass works with, were clogging the system. It was a functional truth that they get stuck due to not having other options, but the problem is not the claimants, it is the system. We will need to extend the commitment in this plan of not othering or blaming to this group of people as well, who have experienced forced displacement in proportions few of us can even imagine. This plan will need to address the fears of the community. There is a point of concern that I have around the plan, as good as it is, around overhousing. I want to caution against that language. How do we define it? Who gets to decide that someone is overhoused? Because overhousing is not just a measure of success. It is also a measure of having nowhere else to go. It is also a measure of home having been well established and community and relationships being built and a place for homecoming.
Shelley, I apologize for interrupting. I'm hoping you're just about finished.
Yes, I am.
Your time is up and have to be pretty tight today with our numbers.
Thank you. I apologize. I'm going to actually end there then with just at the mayor's dinner, we were called to courageous hope. I encourage you to take courage, live into hope, move forward with a yes to this plan with eyes open, hearts tender, and room for all, no matter where they come from and why. Thank you.
Thank you. We have a question from Councillor Deutschman.
Thank you, Chair Erb. Ms. Campanola, thank you for coming in. I certainly appreciate the work you do in the area that you do. My wife and I interact and assist several families, refugee families, in some homes that we rent out to assist these families and work with them on an ongoing basis on various other things that they need assistance with in the community. I'm just going to put this question out to you, and you may not have the answer to it, but I wanted to put it out early so anyone else who's speaking and may have an answer to it can provide some input on the question. And while we call this the plan to end chronic homelessness, a new phrase or term for me was this concept of functional homelessness. And I just need to clarify if you know, or again, if someone else is able to provide an answer to this, is there a difference between chronic homelessness and functional homelessness? And it seems like there's various definitions of functional homelessness. Is functional homelessness dealing with the chronic homelessness population or the homelessness population? So that's sort of I'm trying to better educate myself about this concept that's new to me.
I will not be the expert on this, and I'm sure maybe someone else may be better at answering, but my understanding at this point is they are very connected, and what we are looking is getting down to 3 or less people in a situation of chronic homelessness. So that would mean it's not necessarily 0, but close to, so therefore a functional definition.
And if I may, that's going to be addressed by staff in their report to committee a little bit later after the delegations.
Well, Chair, I think with respect, that's a fair question to ask. Many of these delegations are experts in this field, and I would certainly like to hear from them as well on this particular point. Thank you.
Councillor Craig.
Well, thank you very much, and I appreciate the delegation, the commentary. With regards to the refugee situation, that is brought to mind for me are a number of refugees living in shelters in the region and accessing, and I'm not disagreeing with this, free lunches at some of the churches that they provide for the homeless. Are you aware of this, and have you talked to MPs about the lack of support for refugees in terms of this situation?
I am very aware of this, and yes, we have been talking with MPs, particularly our constituent MP, Mike Morris, laying out the realities of what is happening with the numbers of people that are coming to Canada seeking refuge. I want to point out that 90% of the people that Compass works with do end up having their claim acknowledged and gaining protection here in Canada. So these are credible claims and people who definitely need Canada's protection. It would seem important that we recognize that people don't travel a long way to have a better life. The people we work with had a good life until they were targeted, and then they come here having been forcibly displaced to experience further displacement, and we need to find a way to include them in our thinking as a portion of the new people we are expecting to come into this region, because they are valuable contributors to community and to finding home.
All right, thank you very much.
Thanks, Shelley.
Thank you.
Our next delegation is Laura Pinn. Welcome, Laura. You have 5 minutes.
Okay. Good morning. Thank you for the opportunity to speak in support of the plan to end chronic homelessness. My name is Dr. Laura Pinn. I'm an assistant professor of political science at Wilfrid Laurier University. I've worked on issues of housing and homelessness in numerous capacities, doing research for the National Housing Council, as a program evaluator for supportive housing providers, and as an academic researcher. Since last summer, I've been engaged in the plan presented today, both at the co-creators table and also in the lived expertise prototyping process led by the Social Development Center. I don't need to tell you that this plan is important. It's important not just because homelessness is an issue that touches everybody in one way or another, but because it's about making a Waterloo region that is truly livable. The plan to end chronic homelessness stands apart, in my view, from many responses I've seen in other jurisdictions. It's evidence-based, action-oriented, and with political support, can lead Waterloo region to meaningfully address homelessness. And I just want to touch on 2 points in my short time today about why I think this plan stands apart from other plans I've seen, and why I think it's achievable in terms of making a meaningful difference. First and foremost, the level of community consensus that's been built around this plan is really, truly unprecedented. And I think you can see the number of folks that have showed up today to delegate at this meeting around this. It's been the result of taking time to do the work right, to build relationships, and a willingness, especially on the part of the municipal staff involved in the day-to-day planning, to really listen openly, reflexively, sit with discomfort, sit with disagreement, and listen to community. Collaborative participatory planning sounds nice, but sometimes people wonder, what are the actual benefits of this approach? And researchers have found that this type of approach is essential in responding to homelessness. This is because an effective response requires engaging with lived expertise, as well as frontline service providers, to best understand the ways that the very system meant to help often pushes people deeper into housing instability and insecurity. This is why increasingly funding bodies, increasingly the federal government through the Reaching Homes program, are integrating lived expertise into policy and program evaluation. Building relationships for trust practices to meaningfully integrate lived expertise is complex. And in particular, I really do want to highlight the important work done through the lived expertise prototyping process, which has contributed unique, specific, and actionable recommendations to the plan. Second, and equally crucial, the plan to end chronic homelessness is articulated in a way that understands no meaningful response to homelessness can be without a human rights approach that recognizes the fundamental dignity of all individuals. We cannot respond to people experiencing homelessness with the mistakes of the past, which treated homelessness as a social problem, homelessness a social problem as a problem of individuals with a carceral solution. Consistent with the Canadian Charter of Rights and Freedoms, international human rights covenants to which Canada is a party. At its most basic and minimal level, a human rights approach means that people experiencing homelessness cannot be deprived of their right to life. Increasingly, there's recognition that it means there's an obligation to respect the bodily autonomy of people experiencing homelessness and provide accessible and adequate shelter options. And this plan is a step towards doing so. In the coming months, homelessness will continue to be a pressing issue for the region. Residents at 100 Victoria must have their human rights respected and be making decisions as partners, considering the future of the Metrolinx development at the site. While the community involvement in the existing plan to end chronic homelessness is truly impressive, there needs to be an even bigger table that includes multiple departments, sub-regional municipalities, outreach to the province as well, whose engagement is crucial in actualizing this plan. The plan is just the beginning, but it's an important one. It's an opportunity to demonstrate that the region has the political will and mobilization to lead the way on homelessness. Thank you for your time this morning.
Thank you, Laura. We have a question from Councillor Deutschman.
Thank you, Chair. Dr. Pinn, thank you for coming in. As you know, we've had conversations over time on various issues, and I always enjoy the opportunity to ask you some questions and to talk about these issues, of which you have a lot of expertise and experience in. I just wanted to ask, though, I find this plan to be somewhat of a philosophical document more than an actual specific plan. When I see, for example, at page 9 of the document, we're talking about, let me just refer back to it here. There's, talking about concepts of colonialism, financialization of housing, criminalization of homelessness. These seems to be important issues for debate and discussion, and I can appreciate, no doubt, your group and the people that you participated with over numerous meetings had lots of conversations about that, but I haven't myself recall having any conversations with council about these particular issues. Don't you find this to be more of a philosophical document than a specific plan moving forward?
Yeah, thank you for that question. Oh, sorry, am I allowed to respond at this point?
Go ahead.
Okay. Thanks for that question, Councillor Deutschman. I mean, I agree. I think especially the framework at the beginning of the plan is bringing in these broader conceptual lenses to the problem. And I think that's important in terms of sort of setting out how we want to approach the question of homelessness. I guess what I would say is sort of two things. One is that the plan does have some very specific recommendations. So it sort of starts off broad and narrows down. And there's a whole series of recommendations. Within the official plan that you've been asked to support, those recommendations are still fairly broad. What I really appreciated about the Social Development Center's lived expertise prototyping process is that there are incredibly specific and detailed recommendations in that document, which is attached as an appendix as well. So I agree that there are, it is setting out more broadly the terms of engagement. And the question is always, okay, this sounds good. How do we take a human rights approach? How do we take a decolonial approach and actually make that happen? And I think there are pieces in here that can help lead us on that path. But the other piece I want to say is that I think, too, this is a living document, and part of it is going to be negotiating these issues and the way that they intersect with developments that happen over the coming years.
And if you could, for me, I just need some clarification from your view. When you talk about a human rights approach, is it a UN human rights approach, a Valente decision human rights approach? What sort of human rights approach are we talking about here?
Yeah. So thanks for that question. So Leilani Farah and Caitlin Schwann have this document called the National Protocol. I think many folks may be familiar with it. I know that regional staff working on this plan are. The National Protocol, which sets out a human rights approach in Canada. And I think this document is really useful because it takes international human rights frameworks, which can be very broad, and distills them into very specific actionable principles in the Canadian context. Fundamentally, it means that in the absence of accessible and adequate alternative shelter, forcible displacement of people who are experiencing homelessness and sheltering on public lands is not human rights compliant, and that's something that we've seen in the Valente decision. And I mean, the other thing I would mention is that that's not a standalone decision. There's a recent decision in Kingston, which had similar findings. There's currently a case in Hamilton where the city of Hamilton is being sued for damages for harms done to people experiencing homelessness during a previous encampment protocol that was not human rights compliant. And so, legal action, I think, around this is not going away, which makes it, especially important to get in front of that and really have an approach that doesn't fall into the necessity of litigation.
Okay, thank you very much.
Councillor Craig?
Well, thank you very much, and I do appreciate the delegation. And certainly there's an enthusiasm here to do something and to support the document and to move forward. But I think the underlying problem we have as a regional municipality is the lack of both funding and legislation from the provincial and federal governments. Could you just comment on what that perspective and what you think we ought to do to get these people engaged in terms of helping us?
Yeah, and I would agree. I think, municipalities often end up holding the ball, right? Because we have to deal with the lived consequences of homelessness in our communities. And I would like to see, and I think there's an urgent need for more provincial and federal action. What I would say is I think a plan like this can be useful in mobilizing to gain resources provincially and federally. And I'll give you the example of the City of London, which has been taking a somewhat human rights oriented approach to homelessness, including funding service depots to provide direct services to people who are living unsheltered. And through that approach, they've been able to mobilize reaching home funds from the federal government. And so what I would say is, yes, we need all levels of government to step up. When I talk about housing and homelessness as a policy issue with my students, I talk about it as a multi-jurisdictional issue, an issue which there's a place for federal, provincial, as well as municipal action. However, I think, in the interim, what are we going to do, right? And I think a plan like this is an important step in marshalling those resources for Waterloo region from other levels of government. Thank you very much. You're welcome.
Councillor Salaman.
Thank you. I just wanted to get clarity from Councillor Deutschman. He had asked the framework you were talking about for human rights. Which document is it? Is it, who did you say it was? I'm just trying to find it because that was also a question I had.
Sure. So it's called the National Protocol. And it's put out by the Shift, and it was put out when Leilani Farah was, I think she was still the UN Special Rapporteur on the right to housing. There's also a recent report by the Federal Housing Advocate on encampments that also provides some useful direction around this as well.
Very good. Thank you.
Councillor Vanek.
Thank you very much, and thanks for coming in, and thanks for bringing up Leilani and the work that she's been doing with the Shift. The City of Kitchener's been part of that work together with her. I was intrigued by something that you said, and you referenced sub-regional governments and the need to engage with them, because that is something that I noticed in reviewing the report. And so I'm wondering if you can talk a little bit about, and I presume you mean the area municipalities, wondering if you can talk a little bit about what you see lacking there, and what you would hope to see as this work continues forward.
Sure. Thank you very much for that question. So, as everyone in this room knows, the fact that it's a two-tier municipal government makes things very complicated. So things like property regulation, parks fall within the lower tier municipalities, whereas the region is the homelessness and housing service provider. So there are elements of addressing homelessness as well as housing security that the region cannot, they may fall in the municipal bucket, but the region cannot tackle those alone and make changes alone, right? So in terms of things like parks bylaws, access to washerman parks, access to water in parks, in terms of things like property standards and regulations, thinking around, because, as we know, homelessness is not so distant from issues like rent evictions, tenants insecurity or security, right? And so I think to really fully address those components of the plan, we do need to build a table that includes all of the lower tier municipalities as well, because some of these pieces fall into their jurisdiction, right? But I do think that, you know, this leadership from the region is absolutely critical in terms of setting the bar quite high, you know, in terms of this is the strategic direction.
Yeah, absolutely, but I really appreciate your input in this regard.
Thanks, Laura.
Thank you.
Our next delegation is Aaron Dejay. Aaron, there you are. Welcome, you have 5 minutes.
Thank you. You're getting both professors at once, so you're getting all your academic stuff in one swoop. My name is Erin Day. I'm a resident of Cambridge, and I'm an associate professor at Wilfrid Laurier University. I've been doing research about homelessness for 15 years, including doing research on homelessness in Waterloo region for the past 4 years. I'm here today to encourage members of this committee to fully endorse the plan to end chronic homelessness, and in the months and years to come, to support, invest, and champion the plan. I want to draw the committee's attention to 3 elements of the plan that I suggest make it exceptional. First, there are 3 overarching causes of homelessness. 1, structural factors like rates of poverty, housing affordability, colonization, and discrimination. 2, systems issues where people are not provided with the supports they need and adjacent systems work in silos. And 3, relational and individual factors such as experiences of violence, trauma, and mental health and substance use issues. Almost all of our systems are geared towards addressing that third one, that individual factor one, which, while important, are not capable of reducing and ending homelessness on their own. Across Canada, we have neglected structural and systems factors. This plan addresses all 3 factors. For example, including in its strategic focus area, building bridges between systems like health and corrections. This demonstrates that the plan is comprehensive and will guide the region toward addressing all root causes of homelessness. Second, the plan pushes the region to adopt a proactive rather than a reactive response to homelessness. Since the homelessness crisis exploded in the 1990s, as a sector, we've been playing catch-up, using old emergency responses that were not designed to support this many people and the complexity of the challenges they face. When we are reactionary, we rely on crude, quick, and ultimately harmful responses, like criminalizing people who are homeless and putting them through a never-ending cycle of displacement that makes things worse for unhoused people and the community at large. The plan's bold actions are proactive by focusing on immediate needs and broader issues simultaneously. The plan's emphasis on process as much as outcomes means that as a region, we will be building a robust series of systems that can be nimble and adaptive to people's changing needs and support people without having to fall back on the old ways of doing things. Third, the inclusion of homelessness prevention as part of a plan to end chronic homelessness is pivotal. As one of the co-authors of the 2017 Homelessness Prevention Framework, I have seen firsthand how vital homelessness prevention is, but how quickly it is forgotten when we take a reactionary rather than proactive approach. The only way we will end chronic homelessness in this region is if we stop people from being homeless in the first place. Without the prevention focus, we will be waiting until people become deeply entrenched in homelessness before we offer help. This is unethical and inefficient. This is why I am so heartened to see prevention as a strategic focus area in the plan. This focus will make a difference in the region's response to homelessness. At the region's 2023 National Housing Day event on November 22nd, I gave a talk where I said that the nation is watching Waterloo region right now in terms of homelessness and housing. In the last 5 months, this focus on the region has intensified, both because of the encampment legal decision, but also because of the steps taken towards encampment sanctioning. This plan to end chronic homelessness is exactly what the region needs to be doing as the eyes of the country are upon us. Endorsing the plan and properly funding its actions is the only way forward. Thank you.
You were right on the mark, Aaron, with the time. Thank you. Well planned. We have a couple of questions. Councillor Deutschmann.
Thank you, Chair Erb. Aaron, good morning. Thank you for coming in. Thank you also for participating in my last town hall that we had. And just to let you know, we have actually served that to all the presentations and information that came out of that. Very valuable. I just wanted two things. First, I want to ask you, when you talk about prevention, and there's prevention included in the plan, I don't know if you're aware, the drug action team, Waterloo Region Drug Action Team, who you're probably familiar with, certain various members of that, sent us out an email this morning and indicating that they were concerned that there were no specific actions contained with respect to, again, we're getting all this kind of quickly, with respect to drug issues, I believe, or drug prevention. I mean, so what specifics are you referring to when you're talking about this plan? And when you talk about prevention, what are you specifically referring to? Prevention of what?
Homelessness is the answer. So
Right.
most plans to end chronic homelessness, when we focus on chronic homelessness, because that's chronic homelessness means people who've been homeless for 6 months or more. So we're talking about when they've gotten far into their experience of homelessness. And so very rarely does the issue of prevention, actually stopping it before it starts, make its way into these plans. Or honestly, when it does, it's really like token. They'll name it once. If you control find for the word prevention, it'll come up like 3 times, really minimally. But what I suggest is we're not going to end chronic homelessness if it keeps feeding itself. We're just going to continue to help people. And so I will point to Finland's plan for homelessness prevention is the plan. So it's a homelessness prevention plan in Finland, and that's what has effectively ended homelessness in Finland. So in Finland is the bee's knees of ending chronic homelessness. Did I think I was going to say bee's knees at Regional Council today? No, I did not.
No.
But Finland is the bee's knees of ending chronic homelessness, and it is situated within their plan to prevent homelessness, not in their plan to end chronic homelessness.
So just touching on that, it reminds me of the gentleman from Niagara that spoke from Raft about the approach they take, and he actually cited Porchlight in Cambridge as his guiding model, where they reach out. So you mean prevention, reaching out in the community? I understand, not the drug prevention side of it necessarily. Let me just ask you this: we have a 2-tier system here in Waterloo Region. The region can do what they want to do, but the area municipalities also have their goals and objectives, and not to compare one to the other, but if there's no partnership there in terms of working together. Talk about criminalization. There's the region, there's the area municipalities. I'm guessing you're referring to displacement, like closing encampments and that sort of thing. So, that's still going to be an ongoing issue for Waterloo Region, no matter what we at the regional level do with respect to this plan. We need to ensure area municipality buy-in with respect to this plan.
I completely agree, and I know that the mayors of the cities are at this table, right? So while they are distinct entities and distinct jurisdictions, you also come together here. And so I believe that it's essential that the mayors of these cities endorse this plan specifically, because it needs to be simultaneous. And my research in the region for the past 4 years has been about if we don't want to see homelessness, if we don't like seeing homelessness on our streets, then let's do something about it, because we can't and we shouldn't kick every person who's homeless out of our city. So if you don't want to see it, then we need to respond effectively. And this plan is how we do that.
Good, thank you.
Councillor Craig.
Well, thank you very much, and I appreciate your commentary. I just want to expand a bit on the homeless issue, because I believe there is a new category, and that's young people living at home with their parents that can't get out of the house. And it's an issue, and it's a terrible issue. I mean, you can't buy a house, young people today. You can't finance it. It's extremely difficult. And I think this is a group we also have to be paying attention to. So I'm just wondering, the whole world, well, not the whole world, I'm exaggerating, but all of Canada is looking at Waterloo region. But you must understand that, again, I come back to my earlier commentary, that we got to get the MPs and the MPPs involved in this. And in my opinion, they're on the sidelines. And I think we need to do that. How would you sort of accelerate their involvement and working with us?
So I want to address your first question or comment first. Young people staying at home, I think, is an issue. I'm like planning for my daughter to live in my house forever and trying to figure out how that's going to work. And she's 11 right now. Anyway, so the plan is in the making. So I hear you. At the same time, kids living in their parental home longer is important, but what we're talking about is a matter of life and death. People are dying while they're experiencing homelessness. The life expectancy of somebody who's homeless is 40 to 47 years of age, which is literally half the life expectancy of housed people. So kids need homes, I agree, but we're talking about a crisis doesn't even capture the word I'm trying to explain here. This is a matter of life and death. How to get other jurisdictions on board? I think that personally, that the federal government, there's ability to move there. I think we can tap into stuff happening there. This is a really important moment in time, because kids are staying at home, because middle-class people are feeling the pinch. The issue of homelessness and housing was not, I mean, I've been doing this for 15 years, and I was kind of on the sidelines for, I would say, 10 of those years. In the last 5 years, because middle-class people are starting to see how it could affect them, we have heightened the level of interest and importance of homelessness and housing. So this is a really important moment in time where we can mobilize this interest and this public pressure around homelessness and housing. I think the federal government is there. How you do it with the provincial government, I think, is another question that I'll leave for now.
Thank you very much.
Councillor Schatz.
Thank you. Thank you for, I'm over here.
Oh, thank you.
Thank you for being here today and presenting. This is such an important issue that we're all struggling with. And, when you get to the point that we're at and you're trying to fix a problem and create a new system, it's really difficult, it's really complex, and it's really expensive. You talked about prevention versus reaction, and we're in the middle of doing both of those things. And I'm not sure if this is a fair question for you, so if it's not, you don't have to answer it. But how do you see the different levels of government coming together? Because we're going to have to tackle this together. We can't do it alone here. How do you see each level prioritizing that as we come together? Do you have anything to comment on that?
Yeah, that's an interesting question. I think when we look at, so again, if we look at those three causes, I mean, now I want to pull up my PowerPoint slides about prevention. But when we think about the causes of homelessness, those structural, systems, and individual and relational factors, I think all three levels of government have a role to play in all of them, but I think some of them stand out more. So I do think those structural things fall largely, not exclusively, but largely into the federal government's role, because we're talking about, nationwide poverty levels and things like that. The systems piece, because we're talking about adjoining sectors like health, like corrections, like child welfare, that really to me is clearly in the provincial realm. And then individual and relational factors, like Dr. Pinn said, so much of the failures across all of these pieces end up falling into, and we are visible at the municipal level. So I don't think it's like, one equal. I think the municipality has roles in all of it, but I see that there is a way where leadership from different orders of government can tackle these different pieces.
Are you back on a second question here, Councillor Craig? Or?
Well, thank you very much. Just very quickly, the relationship between addiction and homelessness. Mm-hmm. And I'm concerned about that aspect of it. You just talked very vividly about life expectancy and so on, and I understand where you're coming from. How profound or how profound is this issue in terms of perhaps statistical that you could tell us about, so I understand it better?
Yeah, that's a great question. I don't have the stat off the top of my head. What I do have off the top of my head is that it's under 3/4. Like I want to say in the 60s, but don't quote me on that as I say this out loud. But so I think what's important to think about is absolutely addiction. We can't ignore the fact that substance use challenges impacts people who are homeless. The access to safe supply is a huge issue. But what I also want to point to is there are lots of people who use substances who are housed. There's a lot more people who use substances who are housed than who are homeless. In one of Councillor Deutschman's town halls, somebody who is much more of an expert on this than I am, talked about how 90-something% of overdoses are in homes, right? So like, I know it gets attention, the ones that are outside, but most people who are using substances are in a home. The other thing I want to note is that lots of people that I know personally and that in my 15 years of research were not substance users or were not heavy substance users until they became homeless. And the trauma that comes with homelessness and the despair leads them to engage in more risky substance use. And the line I say all the time, I'm the biggest square you'll ever meet. I don't do anything. And I am sure in my heart that if I became homeless, I would start using substances. Like I know it for a fact because it's an escape when life is so hard and so unforgiving. So substance use is absolutely an issue, but there's so much around it that has nothing to do with substance use. It has to do with not having a home and that hopelessness.
No, thank you very much. No, I appreciate your comments.
Thank you.
Councillor McCabe.
Thank you. Thank you for coming in. Thank you to everyone who comes in. Just picking up on some of the factors you're discussing, one of the things that really jumped out at me in the report, and we'll ask this of staff as well, is that 70% of people, let me just make sure I quote this right, 70% of people experiencing homelessness who are precariously housed have screened positive with the HELPS screener as having an acquired brain injury.
Yeah.
So that to me really jumped out. And so I'm just wondering if in your research what your research has told you about that, because I think that to me just adds a whole other layer to this issue. And there's so many questions, how or what's happened. I assume there's been accidents of some sort that for these acquired brain injuries. But I'm just wondering how that factor levels into the research that you have, and if you just could provide some comments on that.
Yes, such a great question. Thank you for asking it. I also was, so acquired brain injury has only, I would say, come into the sort of sector, into the minds of people doing this research and doing this work on the ground in the last, I would say, 5 years. Like, this is really new. I have never heard the 70%. I was also shocked by that when I read it. So I don't know about this. I'm sure the staff have a citation that they'll pull out, and I'm sure it's valid. But that was very surprising to me, that percentage, but not at all surprising that acquired brain injury is a significant issue. So the research is just coming to the fore right now. Dr. Stephen Wong with St. Michael's in Toronto is doing a lot of this research. And what it's just finding is that people who are experiencing homelessness have a disproportionate rate of acquired brain injury, whether it's the acquired brain injury happened before, and that's part of the reason why they became homeless, or as a result of while you're homeless acquiring that brain injury. That's still not clear. But two things that come to mind. First is that we know that one of the primary reasons why women and gender diverse people experience homelessness is because of violence in the home, and so I think that that's a key factor in explaining the acquired brain injury piece. And the second is, I did my master's research on fetal alcohol spectrum disorder, and needing to have a completely different understanding of what we're doing and what the systems look like and what the supports look like when you are providing support to somebody who doesn't think like we might think, or thinks in a different way. It's a game changer to understand that maybe decisions people make or behaviors they engage in is not by choice necessarily. It's not because they want to, quote unquote, be difficult or hard to serve, or whatever those words are. It's because they are struggling in all sorts of different ways, and we need to have different understandings of where they're at in order to provide that support.
Thank you. I think that's just something, sorry to editorialize a tiny bit, but I just think that's really something we should keep in our minds as we go forward and think about this. Thank you.
Absolutely.
Thank you.
Thank you so much.
Presentation and for answering the questions. Our next delegation is Christina from the Cambridge North Dumfries Ontario Health Team. Christina, welcome. You have 5 minutes.
Thank you. Honorable council members, my name is Christina Eliashevsky, and I did not put the phonetic spelling in there for you. I apologize. I'm here as a representative. I'm the director supporting the Cambridge North Dumfries Ontario Health Team, the CND-OHT, and I'm here to address you today in support of the plan to end chronic homelessness. The Cambridge North Dumfries Ontario Health Team comprises 44 agencies and health service providers from Cambridge, North Dumfries, and Waterloo region. Your questions were a great segue to lead us into a conversation about health and homelessness. We envision a community where people access seamless and integrated services to ensure the health and well-being of our diverse populations. Working collaboratively as an Ontario Health Team for over 4 years, the CND-OHT has seen several improvements for both patients and providers in our community. This collective work has also enabled us to explore issues and opportunities in new ways, engaging the front line in health and social services to inform our approaches and solutions. Unsurprisingly, access to stable, affordable housing has been a theme in the CND-OHT discussions for several years, both within the context of specific population health projects and overall community well-being strategies. As such, the CND-OHT is pleased that the plan to end chronic homelessness is being considered today for endorsement. As a recent member of the co-creators table, the CND-OHT values collaboration and partnership, recognizing its significance in addressing the complex issues facing our community, particularly in the realms of health and homelessness. The plan to end chronic homelessness has identified building system bridges as one strategic focus area, which strongly resonates with the coordinated planning efforts of the CND-OHT and homelessness initiatives. It is imperative to better align joint priorities between homelessness and health to ensure that we can effectively serve our communities in need. Matt Harrigan from CMHA and a member of the co-creators table will further elaborate on the critical need for improved coordination between mental health supports and the homelessness system. Furthermore, we recognize the importance of adapting and evolving, our frameworks for homelessness in conjunction with health services, as this falls under the plan's policy focus. Equitable housing is also a key component of our approach, emphasizing the necessity for enhanced wraparound social and health supports for individuals with complex needs. One emerging area that requires urgent attention is the looming issue of medical frailty. This is most potently demonstrated in the intersection between complex medical needs and homelessness, particularly amongst older adults. There is a pressing need to collaborate closely with local hospitals to address the challenges faced by individuals who are discharged into homelessness. This issue will only escalate as our population ages, And we must work proactively to bridge the gap in mandates and services. That is, addressing medical frailty in our aging population will require an unprecedented level of collaboration and commitment to innovation. Primary care, mental health, and addiction services are of paramount importance, especially for individuals experiencing chronic homelessness. Integrating these services with housing supports can prevent homelessness or quickly remedy precarious living situations resulting from health issues. Indeed, there is enormous potential to unleash creativity and capacity through the organization of our primary care providers into more structured networks. We as an OHT remain committed to championing this work in support of the care needs of those who are homeless and in support of our communities in general. To respond to these challenges, the CND OHT supports formalizing a whole-of-community leadership process as outlined in the plan to enhance integrated systems planning with a particular focus on health. We firmly believe that by working together, we can leverage our collective resources more effectively and efficiently to address the root causes of homelessness. While we acknowledge that the plan was not developed by our OHT and that Council does not directly fund health initiatives, we urge for greater investment from upper levels of government. However, our collaborative efforts can strategically position us to have greater impact when funding opportunities do arise. In conclusion, our approach must remain person-centered, ensuring that the voices of those who use and need our services are heard and included in the decision-making process. Together, with your support, we can build healthier, more inclusive communities where everyone has the opportunity to thrive. Thank you for your time and consideration.
Thank you. I don't see any questions. Thank you for being here.
Thank you.
Kevin White is our next presenter. Kevin, you have 5 minutes.
Does this go any higher? Oh, it'll count me. Okay, good. Great. Good morning, Council. I'm speaking to you today regarding the Plan to End Chronic Homelessness report and urging you to support the proposed recommendations, including to direct staff to develop a comprehensive funding and advocacy strategy. I believe the funding aspect must be brought to Council's attention, as Council has previously underfunded staff housing plans, providing approximately only 10 of the $14 million requested increase in the 2024 budget. At a regional council meeting on January 24th, 2024, there were points raised in this council chamber which I would like to identify. One councillor noted that new money went to the proposed staff housing plan and that it was not a cut to funding. It must be understood that underfunding in this way is not a cut, that is true. However, it is a setup for lowered or reduced expectations or even failure. Another councillor noted concerns that a better tent city would be receiving its proposed funding despite failing to meet regional criteria, suggesting that this was inequitable. A better tent city provides needed services that others are sometimes unwilling or even afraid to 24 hours a day. An immense amount of this is volunteer or unpaid labor. A better tent city is a project that the region relies on, boasts about, and has been granted positive recognition for, including at the federal level. What do we imagine would happen if a better tent city stopped providing service tomorrow? It needs and deserves the financial support of the region regardless of criteria. That's equity. Another councillor expressed confusion that some of the new money was going toward providers that the region had budgeted for service in previous years, as though the fees for service could remain static while demand grows and supply wanes, and wondering if we could reduce funding to previous levels or remove it as a line item in the expanded budget. Another councillor expressed concern about supporting the plan and various services simultaneously, suggesting that they hope we can do better, and that they would rather find another solution than take away from the groups that provide the vital services. I will remind Council that the concern in this instant was about the plan and services receiving budget money that was being allocated by Council's decision. If we want to do better, make the decision to approve adequate levels of funding that staff, service providers, and projects require and do not underfund their endeavors. This all relates to budgeting, and the point is this. Whatever the plan to end chronic homelessness with its target of functional zero chronic homelessness by 2030 will eventually ask for in terms of finances, it will be too little. And the number that Council will be given will be too low because staff and providers will be trying to appease a Council that has repeatedly underfunded them and proposed austerity when it comes to valued and needed community services. The plan to end chronic homelessness highlights a need to address systemic issues and assumptions. Given the region's efforts over the last 6 years have, for a variety of reasons, ultimately resulted in a growing homeless population, including more than tripling the homeless population in the region between 2018 and 2021, it seems very important to consider that what the region's systems have been and what needs to change. Continuing on the same path that resulted in increased issues will not resolve them. We have a rapidly growing population in general, including a growing homeless population, a growing hidden homeless population, and a growing precariously housed population, with only a very modest increase in housing supply, and virtually none of that supply is truly affordable. The Waterloo Region Community Foundation's 2023 Vital Signs report noted that for every 4.7 newcomers to Waterloo Region, there is only one new housing start. That same report indicated that the vacancy rate for units affordable to the bottom 20% of renters was 0.0% in 2022. The Plan to End Chronic Homelessness report notes that in 2024, approximately $56 million will be invested into the local homelessness system. Based on current state and future trends, this investment is not keeping pace with the growing need for additional supports to end chronic homelessness. The report also notes a 20% increase in youth homelessness from the previous 2 years. This follows the closure of a youth drop-in shelter that the region elected not to financially support in September 2023. The region must not continue to underfund housing and community supports. A sustained and substantial financial commitment to housing and relevant support services is vital for this plan to have a chance to succeed. We need council to be supportive and committed. We need council to be accountable. With adequate support for the plan to end chronic homelessness, the region can establish more positive relationships, develop trust, and provide a great benefit to the community at large. I urge the members of this council to support the plan to end chronic homelessness and leverage what connections and resources you have at your disposal to further regional support for the plan. Thank you.
Thank you, Kevin. Thanks again for being under the time limit. Thank you. I see no questions. Thank you for appearing. Our next delegation, and I apologize for the pronunciation of your name. Perhaps Hedbias? Are you here? Right there. Thank you. Welcome. You have 5 minutes.
Thank you very much. So my name is Hadembes, so it's pronounced Hadembes, and my last name is Yebetit. I apologize for not putting the pronunciation when I registered. So it's Hadembes. Thank you very much for this opportunity, and I'm here to support the plan to end chronic homelessness. In particular, for the part that we don't pay much attention to those newcomers, asylum seekers, refugees who are really hidden homeless population in the region. So I am going to present my ideas out of my heart from the connections that I have working with refugees. By the way, I am a settlement counselor with the KW Multicultural Center. So my daily activity is working with refugees. So I know whatever it is their problems. Much has been said from my colleagues here, and especially from the professors who brought the statistics and researches, but there are many more other problems. So in the region, we are not prepared to welcome refugees, my experience, because of overcrowding apartments and housing at the moment. They cannot find a house because it is estimated, very expensive, and rare to find. In addition to it, unemployment and minimum wage are not helping them to solve their problems. For this reason, newcomers and refugees are concentrated in apartments, people living in one bedroom, like 5 to 10 people at the same time, taking shifts to take shower, to sleep, and to relax. There are increasing number of mental health issues like suicide, violence, and drug addiction, as we see them in newcomers, especially in high school stages. There is a lot of family breakdown going on because of crushed families in apartments, lack of employment, and unaffordable cost of life. So the plan to end chronic homelessness is the best we can get today, and I urge everybody here to support it and to fund it completely. So the main reason is today we are speaking about visible homeless population in the region, but tomorrow those who are hidden today, the hidden homeless, will be visible before we even notice it. So we need to prevent it, and we need to solve that problem. Thank you very much.
Thank you. I don't see any questions. Thank you for appearing. Our next delegation is Leslie Crompton. Welcome, Leslie, and you have 5 minutes.
Thank you. Oh, there we go. I had to bring this down a bit. I am Leslie Crompton. I'm a long-term Waterloo resident, a member of the Unsheltered campaign. I know a few of you know me from there. And I'm part of the Plan to End Chronic Homelessness Continuum of Care Prototyping Working Group. In addition to that, I'm a professor at Conestoga College, teaching all international students, and I run a free tax clinic for low-income individuals and families. Through this work, I come into all levels, contact with all levels of individuals and families, from newcomers, refugees, students, our seniors, our parents, women escaping abuse. So I have a wide perspective on homelessness and the need to prevent it. Before I get into a little bit of that, I do want to thank regional staff, especially Peter Phillips and Fran Trong, for their work with the Lived Expertise Prototype Working Group, the co-creators, members in the community. Developing a strategic and progressive plan with the impacted community is often fraught with emotion, discomfort, and anger. Regional staff listened, acted, and dealt with situations and individuals in a constructive and positive manner. During this process, I have observed mutual aid organizations, service providers, and regional staff, often groups I never thought I would see in the same room, working collaboratively on immediate initiatives such as winter survival for those in encampments. This is a new phenomenon, and it's beneficial to those living in encampments and to those supporting them. A quote that I think of at this time is, "A burden shared is a burden halved." And I think as we listen to all, or as I listen to all the other speakers and delegations, I think that message is coming really very, very clear that this has been collaboration. It's all of us working together to solve this problem. And it is. It's obvious that the diversity and the number of delegations that have come here, that homelessness and preventing homelessness significantly impacts all members of the region, regardless of race, religion, age, gender, and working status. There are a lot of working parents and individuals living in motel rooms trying to get back into a stable environment. The plan recognizes that to end chronic homelessness, a multi-pronged approach is required. We have to resolve the existing chronic homelessness and help those that are already living with it, but even more importantly, we have to prevent it. We have to turn off the tap. This approach must be embedded in all the decisions that the region makes, now and into perpetuity. This is not just a one-time plan. All decisions, whether or not they specifically deal with homelessness and housing, do have an impact on that. Everything we do can have an impact, even though we don't think it does. I support all the calls to action, including the detailed ones found in Appendix C, Lived Experience Final Prototype, we got a lot of words here, report, but I do want to highlight a couple. When we talk about working together and the prototyping that has been done and making sure that all decisions that are happening in the region. That is called Action 2-1, where we continue the creators table, but we expand that and get into further. I'd also like to highlight a time-sensitive action at 1.8, which is the create a climate and extreme weather protocol based on a human rights approach. This past winter has been very light, and we didn't need to do as much, but we need to have emergency plans in place, and we have to start planning for those now. If the emergency plan doesn't have to be triggered, that's great. I take that as a KPI that all the work on this plan to end chronic homelessness has been successful. Youth homelessness. I spent the day yesterday doing taxes for at-risk youth at CFSA. One youth story hit harder than others, probably because he's a few years younger than my son, who lives at home. Here, a peer-to-peer support worker visiting encampments, dealing with overdoses, while living as part of the hidden homeless and worried on a daily basis about where he and his dog would find their next meal. A youth that has never known a stable home, but provides supports to others on a daily basis. This youth I can see definitely getting involved in the call to action 5.2. I do echo a lot of what all the other delegates have said, and there's a variety of things. I know that we have talked about how do we bring in the other levels of government. The Social Development Center, as well as other members of the community, have already started these types of discussions and held an event a month ago at the Ray of Hope, where we invited the MP and the MPPs, and Karen also attended that, to talk about how do we get the help and support from those governments, because you're right, it is, all levels have to be involved.
Leslie,
Sorry.
I apologize.
Yep,
for
I was just going to
interrupting.
conclude.
You're at 6 minutes.
Okay, sorry. My ask is please endorse this plan.
Thank you. I don't see any questions.
Thank you.
Thanks for your attending. Our next delegation, Jamie has withdrawn. And so we're on to Brittany Elmsley, representing the Immigration Partnership of Waterloo Region. And Brittany, you're online, I believe. Welcome.
Yes, hi. Can you see me? Can you hear me?
We can hear you, and you have 5 minutes.
Thank you. Good morning, Chair Erb, Chair Redmond, members of Regional Council, and my colleagues from community. My name is Brittany Emsley. I'm the Vice Chair of the Waterloo Region Immigration Partnership Council. The Immigration Partnership is a multi-sector partnership initiative that for the last 15 years has brought together more than 60 immigrant and community service, business, post-secondary, municipal, ethnocultural, and other organizations across the region of Waterloo to create the conditions for immigrants to succeed and help build a thriving community for all. Our collaborative work focuses on 3 priority areas, or pillars: settling, working, and belonging. Over the last year, the Immigration Partnership has participated as a member of the Plan to End Chronic Homelessness co-creator group. It was important for the Immigration Partnership to collaborate on this important work. In recent years, immigrants in Waterloo Region have told us that access to affordable and appropriate housing, or the lack thereof, has grown to be one of their biggest concerns. They move and live here in the context of a housing crisis that affects everyone. Our organizational partners are very concerned about housing and homelessness in general, and among immigrants in particular. We see that this is an issue that affects different groups in different ways and is an all-of-community issue to solve for. As a partnership, when we talk about immigrants, we're talking about everyone in Waterloo Region who was born outside of Canada. So residents, economic immigrants, sponsored family members, refugees, refugee claimants, work visa holders, international students, Canadian citizens, and more. Our immigrant population has grown extensively in recent years and is experiencing the same Immigrants experience homelessness in Waterloo region along with Canadian-born residents. Their experiences may not be the ones most visibly apparent in, for example, encampments yet. Some arrive chronically homeless from refugee camps in other parts of the world. Others are among the hidden homeless, shift sleeping and couch surfing. Others are living in their cars. The Immigration Partnership got involved in this work to contribute to community conversations, planning, and access on homelessness affecting some of Waterloo Region's most vulnerable residents. We got involved to share our experience of collaborative community and planning across sectors and organizations to achieve shared goals. We got involved to help broaden our view and understanding as a regional community of housing experiences and growing homelessness to help ensure this community plan is holistic, equity-informed, and systems-focused. We have been pleased that, together with others, immigrant-serving partners were involved in this work and that immigrants were also involved in the lived expertise group. After more than a year of collaborating with regional colleagues and the many deeply invested community partners which have contributed to this work, I am here this morning on behalf of the Immigration Partnership to affirm the importance and direction of this plan and the associated investments. Its vision and model for shared community and lived expertise leadership, systems change, prevention, and collaboration are what people experiencing homelessness in Waterloo region deserve. Thank you.
Thank you, Brittany. I don't see any questions. Thank you for being part of the meeting. Our next delegation is Heather Mann. Is Heather here to be in person, I think? Okay, we'll wait to see if Heather shows up a little bit later. Stephen Jackson. Welcome, Stephen. You have 5 minutes.
So I'm Stephen, CEO for Anishinaabe Outreach. We call it AO. First, I'll start by sharing some facts. About a year or two ago, I read an article. It was a validation study that said if you give people essential life skills and mental health,
Stephen, I apologize for interrupting. I'm wondering if you could lift the microphone up, please. Thank you.
Sorry, do you want me to start over?
Go ahead.
Okay. So Stephen, CEO, Anishinaabe Outreach. About a year or so ago, I read an efficacy article. It was a validation study that said if you give people essential life skills and mental health, you can heal them out of anything, including homelessness, addictions, incarcerations, things like that. AO actually believes that you need to include job readiness training and employment, and that'll be part of our validation study. We know that there is actually a care, so foster care to prison pipeline. If you Google the number of people that are incarcerated that used to be in care, it's 50%. If you look at, and you talk to all the other executive directors, somewhere between 30% and 70% of those people in all those shelters also used to be in care. In other words, you could solve the problem simply by helping people with their mental health and their unresolved traumas. Back in 2015, Upstream, Waterloo, looked at proactive prevention. In 2019, Wellbeing Waterloo looked at chronic homelessness. Some agencies support 3 generations of families. There's a 10-year wait list, and some people have been in supportive housing for 20 years. In other words, the systems have created doors and windows in, but not doors out. I participated in I don't know what it was, webinar, I suppose. It was the U.S. Homelessness Advisor to the Biden administration and Harvard, and they talked about 3 pillars and the requirement of 3 pillars. First pillar is proactive prevention, second pillar is crisis intervention, third pillar is supportive housing, and they also had one other requirement. It is the integration of all agencies, government, and business to solve the problem. Ironically, the current state of the system, as outlined in the report, actually is those three pillars. The future state is bereft of the first two pillars. In the past 5 years, hundreds of millions of dollars have been spent on this problem, but homelessness has increased by 28% per year, despite the interventions and previous initiatives. Implementing housing first, as defined in the report, also requires resolving addictions, mental health, essential life skills, and community reintegration. Appendix 3, this is current health partnerships from your housing unit and programs. None of them are related to mental health or essential life skills. This is from the mid-project key finding report. A really big deficit is the US knows that the largest or the fastest growing population of homeless people will be seniors. This isn't being addressed in the report at all. It's the gray tsunami, and literally, we have to address the needs of that population if we want to address homelessness. Within the 6 years, that's going to happen. Page 35 of the report, root cause is incorrectly stated, and if root cause is wrong, you're not going to achieve the outcomes you're hoping for. And surprisingly, most of the quotes in the report say trauma, addiction, and mental health support, but these foundational elements aren't listed, and many of the delegates have already talked about that. So, AO is not supportive of this plan in its current draft. It needs to be including these elements. The report seems to have been created under the shadow of confirmation bias and a psychological principle called groupthink. I encourage council not to participate in that. In the next 5 years, you're going to spend hundreds of millions of dollars of taxpayer money on this, but not achieve the outcomes you're hoping for. Again, you don't have root cause right. And you don't quite understand the interaction of the various systems. And for me, there's an opportunity cost. If you read Dr. Nelson's letter to Commissioner Sweeney, it talked about all of the other cities that have achieved great outcomes. They've achieved them because they included the three pillars. And you need to do that also. And in 5 years, you could solve this problem. If the proactive prevention piece is not done correctly, if it's done correctly, it will also address intimate partner violence, addictions, incarcerations, trafficking. And I guess I should also say that for the last couple of years, we spent time building a solution that delivers mental health as part of a software system. We're partnering with the agencies I've already described, other cities, reserves. We're going to use that to help them deal with their challenges, which are the same challenges that we have. The other thing that AO considers is that mental health is actually a human right. Might not be for all of you, but for Indigenous people, I consider it to be a human right. And without mental health, you simply can't work, and you simply can't afford your house, et cetera, right? So,
Stephen, I just want to remind you, we're at 6 minutes.
I'll just conclude. Thank you.
Thank you. Thank you. Councillors have some questions. Councillor Salomon.
Thank you. Stephen, thank you very much for coming in for your delegation today. I share many of the same concerns that you do. And although it was an interesting philosophical read, I do struggle that it's not hitting the root causes that you also, I believe, are alluding to that are my concerns. And I really appreciate you bringing light to that and coming to speak today.
Yeah, and thank you. I'm sorry that I'm probably the only person here that's saying don't endorse it. You need to push it back and get all those things included, because the extra 3 or 4 months that you're going to spend on this will pay out dividends in the next 6 years. We have to solve the actual problem, not
I absolutely
not the
agree. I absolutely agree. Thank you for coming in today.
Councillor Deutschman.
Thank you, Chair Erb. Stephen, it's good to see you. You and I have had several conversations over the past couple of years, and I always enjoy our conversations. They're very insightful and enlightening, and I really am just amazed at the work, gobsmacked or what have you, of the work you're doing at AO with the dashboard. And I was curious what you were going to have to say today, because I wasn't sort of seeing you as part of the trend. And so you pretty well raised a number of issues and concerns that I have, and I appreciate you coming forward and expressing those when that's a difficult thing to do. And I was going to ask you, you sort of answered the question about the status of your dashboard, which I think it would be, I think, a great thing for regional council if you would come back and do a presentation to show what work you are doing and what tremendous benefit this could have to our various populations within the region. So where are things at with that?
Well, thank you for that question, Rob. We're in beta test right now. We anticipate having the full system operational in June, late June, with the idea that it's going to roll out to leaders of so we're partnering with all kinds of organizations, not this city per se, but other cities where we're actually helping them end homelessness, addictions, incarcerations, things like that, also with reserves. So June, yeah. Parts of it are already available, though, and already being tested.
Well, I look forward to following up with you and reaching out about participation in a future town hall to talk about the work that you're doing. So thanks again for coming in, Steve.
Perfect. And if council is interested, I'm happy to share the system that we've built.
Councillor James.
Thank you, through you, Chair Erb. Thank you for coming in, Stephen. It was good to chat with you the other day, and that webinar that you watched, I watched it as well, and there were some very insightful things. Can you just repeat those 3 pillars again that you spoke about?
Sure, they're also in the report, though. Like,
Yeah.
it's your current state. It's proactive prevention, reactive crisis intervention, and then supportive housing. But supportive housing is third. And there's also a principle that's required. All levels of government and business and agencies have to work together to solve the problem, because this region isn't responsible for mental health. So you have to encourage Ontario Health, Ontario, and also the feds. You have to partner. You have to do what we do. We partner to solve that part of the problem.
Okay.
But it's required. Well, we also have a software system that will also deliver it without needing a therapist.
Yes, I have seen that tool as well. So, one of the things I'm conscious of in going through this report is the recognizing that, the systems approach that has to happen here. So justice system, I'm conscious of things like the family and children's services and the pipeline that's created there, and in terms of what happens when these youth and young people opt out opt out of care, and where that's feeding in, and the preventative nature from that aspect. And then you'd mentioned the seniors as well, those older adults who many I'm very aware of that have never experienced homelessness at all, that we're seeing the trends, and that webinar was very insightful from a United States standpoint, but it's not exclusive to what we're seeing here.
Thank you. I think one of my challenges is, if we look back historically over the last 20 years, I talked about doors and windows in, the problem has gotten worse. In other words, we haven't solved anything, and sorry about that, and until we actually deal with mental health and the trauma, which is the root cause of all of this, well, it's actually unresolved trauma, which is the root cause of all of this. If your mental health isn't solid, you literally cannot work. And if you cannot work, you cannot feed yourself and you cannot pay for your house. Our system is help people heal, help resolve trauma, give them the essential life skills that are necessary, but also do more than that. Help them get employed so they can buy their own houses and feed themselves.
Okay, just one follow-up, Councillor Erb. It's just regarding the Housing First model then. So do you believe the Housing First model is a successful model? I want to understand clearly what you're saying there, because I get the mental health piece, absolutely, right, but the Housing First model, what perspectives on that? And I'm thinking about to that webinar and what was said regarding that too. Thank you.
So with Housing First, if you also read Dr. Nelson's letter to Commissioner Sweeney, Housing First isn't housing. It's housing and all the support pieces. Without the support pieces of community reintegration and the mental health and the addiction pieces, it's not going to work for you. That's the issue. So Housing First, if you do the totality of it, yes, but we're not doing that. In fact, we've scaled it down just to supportive housing. And I will also share, if you get really good at funding and building supportive housing, all the other mayors and all the municipalities will simply send them over to you at the cost of a bus ticket and a Happy Meal. Here you go, enjoy it.
Thank you.
Councillor Hunick.
Hi, thank you very much for your delegation. You mentioned that the plan to end chronic homelessness doesn't refer to seniors specifically, and you're right, it doesn't. But I would think that the comprehensive measures outlined in the plan would meet the needs of seniors as well as the other populations. Could you speak a little bit more about the reports, about the supports that you think are not there that should be?
Well, seniors, and you focus specifically on seniors, the challenge that is actually the economy, because inflation, et cetera, has pushed it with fixed income people. What we're gonna do is we're gonna push people out of the ability to pay for whatever lifestyle they happen to be in, right? So I think there's gonna be things that the region is going to have to do to support that problem. Personally, I haven't done a lot of research in that quite yet. It's something that the US federal government knows is an issue. It's the biggest growing population, but it's coming your way, and it's going to be your biggest problem within 5 years. And if we don't help seniors, I mean, think about it, they drove the economy. Why wouldn't we help them?
Well, I think the plan is designed to help people of all ages, but I really appreciate your insights. Have a great day.
Thank
Thanks.
you. I don't think it's going to work at its current duration without mental health or the trauma or all the other pieces, right?
Councillor Craig.
Well, thank you, Mr. Chair, and I do appreciate the comments that we're hearing. The term mental health is a term that's used everywhere, okay, in terms of, quote, wraparound services. We need more mental health capacity at the hospitals and so on. So when you look at the problems we're having with the people that need that sort of support, what is the capacity, the existing mental health facilities or people to help that population? Because I think it's absolutely overwhelming in terms of an issue.
Absolutely. It's not possible to solve the mental health problem that we're dealing with using the current system, because there aren't enough therapists on the planet to solve our problem. It just won't happen. And the one element that you overlooked, and I don't mean to be disrespectful, it's essential life skills are also part of that. You need to provide people with essential life skills, because if they lack those, they also get into those other systems, right? So what AO did, we recognized this was a problem. We did the math on a long time ago. We said, if we tried to deliver mental health by a therapist, not possible. We built a software system that emulates what a therapist would do with, we just teach people how to heal themselves with using, and we're gonna provide it to all the agencies because we don't have the last mile. And what I mean by that, I'm not connected to every person that needs mental health, but agencies are. And if we simply provide our tool to them, which helps them resolve it, then what will happen is they can actually support those people out of their systems and off their wait lists.
Well, no, I appreciate that. Thank you very much. Okay.
Councillor Foxton.
Thank you, and through you, Chair. Well said, Stephen. Everything you said is right on the head. We know we have to now, perception-wise and public-wise, people want them in a home, off the streets. Understood. We know that doesn't solve the problem. Every individual in this room knows that. But looking at this room today, I got hope, because it's not regional council. It's not the municipalities. It is everyone. So yeah, let's bring the pillars in, and we've talked about the pillars for the last 10 years, and we've stated them, but they've got to be forefront. So let's get them here. Let's get them the assistance they need. Let's make people well again, which is exactly what you're saying, the wellness. And the program did state preventative, but we need it maybe change the term to preventative, but living well is a really good term to use, because I think we believe in that. And if we really want to end homelessness, people have to be able to live well and know they're not alone, that they're connected, and we're all connected together. So thank you so much. Good point, brought it forefront, and thank you, all of you.
Yeah, thank you. And I agree. I hope also There's elements that I do support that are in the plan. However, it's missing the key elements that aren't going to achieve the outcomes despite spending hundreds of millions of dollars. And I'm going to encourage all of council not to spend that money until you get it right. An extra 6 months won't hurt anything, but 5 years of lost opportunity will.
Councillor Wolf.
Through you, Mr. Chair. Again, thank you very much for your presentation. I do have some questions. You say that we need to work together, all levels of government, and I was wondering how you would get the province to cooperate. Because right now, you know, we've asked for OW to be increased, we've asked for basic income, we've asked for different things, we've sent letters, we've asked, but we're not getting the funding for mental health. We're not getting the funding to take people out of poverty.
So I was at another event over in Guelph that was looking at ending homelessness, also the wrong approach, which is housing first, not by the right definition, but by the definition you're all using. And there was a doctor there from Toronto who had worked in Regent Park. They had 51 residents that went to emergency rooms, and my stats are slightly wrong. I think it was over a 3-month period or 6-month period, and it was about 1,000 visits in that 6-month period. The problem is the enormous cost on all the other systems that you're overpaying for. It's in your report, it's in one of the letters. That's the argument. So you make a business case based on numbers. Like, I guess an ounce of prevention is way better than the pound of cure you're currently using. That's my perspective on it. And I would work with government in partnership with them. They need to do this for you, because if they don't do this, it's actually their crisis also. It's their money that they're wasting. It's all taxpayer dollars, not just the regions.
Oh, I agree. And I do like, I think in the plan, we do talk about life skills and education, and I think that's extremely important, and the whole idea of the prevention. And so I'm understanding in terms of mental health, how you would deliver that is through a software system. So could you elaborate a bit on that?
Oh, sure. It's a learning management. And I'm actually happy to come back and just show it to you,
Okay.
or just all of you in a room, or whatever the case is. Be easier. It's a software system. One of my partners is IBM. IBM is actually building a mobile phone app for us that's going to deliver emotional intelligence. And you probably ask yourself, if your emotions are out of balance, mental health gets out of balance really quickly. Because you go, what's wrong with being too happy? Well, too happy means, well, the medical profession says, oh, you're manic, and they give you pills and they lock you up for that. You know, if you're too sad, it's called depression. If you're too fearful, it's called anxiety. Too much of any emotion that isn't resolved or regulated becomes a mental health challenge for you. The rest of the system just simply teaches people. We provide a lot of information and we provide a lot of worksheets that would emulate what a counselor would normally do. So we just teach you the background information, so we do all the research and everything so you understand it, and then you go about solving your own problems, whatever they happen to be. And we've broken it down for really 5 main stages of life. We broke it down for parents with their children, for relationships, at work, as well as supporting the seniors in their life, the people that are moving into retirement and on to death. And by doing all those things and looking at grieving and looking at trauma and looking at things like anxiety and anger and bullying and all the other elements, and relationships, that's key too, and also intimate partner violence. It's thousands of hours of courses that you can work your way through to solve your own problems.
Okay, thank you.
Okay, thank you. We have 2 other councillors on the list, and then I'd like to move on to the next delegation. Councillor Liggett.
Thank you, Mr. Chair, and thank you so much, Stephen. I really was interested in what you had to say, because I find so much commentary and thoughts become performative rather than solving problems, or at least trying to come close to solving them. I don't think we'll ever get to that point. And it troubles me that we teach people to be victims for all of their lives, and you're talking about doing something different here. You want to teach them how to pull themselves out of being victims and not letting it cripple them. So they're doing the work along with somebody else aiding them, and I think that's what you're trying to say. Is that true?
Yeah, that's absolutely what I'm trying to say. But I'm saying that all the systems, like all the agencies, actually perpetuate the problem because they created doors and windows in, but no doors out.
Right.
That's the issue. So what we're actually going to do is we're going to teach agencies how to support their clients differently so they can get clients out of their doors and onto the rest of their life.
So that would take the funds from provincial government to help with the assistance with professional mental health and bricks and mortar, that sort of thing.
Thank you for that comment. So AO is not funded for any of this by anyone. My partners are people like RBC, IBM, Manulife, TELUS. They help me a bit. It's whoever we have to partner with. I actually believe this is your problem. I believe upstream Waterloo has the ability, like the fund that you have, upstream funding, has the ability to proactively prevent all these issues.
Thank you so much for coming. You've been a breath of fresh air, so thank you for tethering us.
Councilor Benedict.
Thank you very much, and thanks, Stephen, for coming in and all the great work you do at AO. You know, I've been listening to both your presentation and all of your responses, and have been quite intrigued by it, because I think, you know, you've identified some of the, you know, well, there's a lot of good work, as you've identified. There are some things that still seem to be missing in terms of the report that's before us, and part of what we'll have to grapple with as council is how to move that, what's the appropriate way to move that forward. I guess my, you know, as I listen to the notion about the need for crisis intervention and proactive prevention and supportive housing, some of this kind of links to the notion of the connectivity tables that have existed, and recognizing that, in fact, if we want to tackle these issues, we need to take a coordinated approach, partially because it also allows us to better use resources to tackle that. And so I'm just wondering if you've had any experience with those locally or elsewhere, and how you think that concept fits in with what you're raising today.
Sure, thank you, Barry. So, and I agree with what you said. That's also what the US government or Harvard said. You literally need to link all agencies and all business and all governments to address it, right? You don't have a vehicle. I have a vehicle. The vehicle is a software system that can align everyone, and they can all just use it. That is actually the solution. That's how you link everyone together. Because again, you're not the last mile either. Like, you don't help homeless people. All the agencies help homeless people, right? You do some things, but not everything. And we need to do that holistic approach. We're partnered in Guelph right now, or I'm partnered in Guelph with another organization. It's like an epidemiologist. He has 3 PhDs. And we're looking at ending homelessness for Guelph. More recently, I think he's going to declare an outbreak for all of Canada. Epidemiologists get to do those things. We're also partnering with reserves, because the tool set that we've created will likely solve all of their problems. But we have to go through the pilot phase. There's a lot of stuff we're still doing on this process, right? I mean, the thing isn't even quite built yet.
Yeah, this is the great, and I certainly like to reach out to you to learn more about this, the work that you're doing in this space.
Yeah, certainly. Anytime, just send me an email.
Yep, awesome, thank you.
And that goes for any other council member too.
Thank you, Stephen.
Thank you.
Our next delegation is KLG.
Thank you very much. Yes, my name is Kay Elgie. I'm a resident of Waterloo. I'm not here today representing any one group, but I do attend meetings of several, including Waterloo Region, Yes in My Backyard, Green WR, a group promoting green development standards, Architectural Conservancy Ontario, Union Co-op, Acorn, and I also sit on the City of Waterloo Committee of Adjustment. So a common thread here is housing. This is a fantastic report. To me, it's revolutionary because it has successfully integrated the voices of lived experience experts with those of academics and government bureaucrats. And I was once a government bureaucrat, so that's not a pejorative term to me, but rather a profession I deeply respect. And if we implement the report suggestions, and more to the point, if we fully fund them and not chip away here, there, and everywhere, we could revolutionize housing. We could really say, yes, Waterloo Region is a place where housing truly is a human right. The changes called for are radical. It would take exceptional leadership and collaboration. And I do stress leadership and collaboration because, as many delegates have pointed out, the region is not legislative responsible for every action recommended in the report. So to implement these radical changes would take exceptional leadership and collaboration. And it would take standing up to the false promises of our provincial government that giving more and more breaks to the private sector will give us the affordable housing so many people need. What this report calls adequate housing, because it won't. I'll give you one example. Bill 134, the so-called Affordable Homes and Good Jobs Act, defined affordable housing as housing that takes 30% of household income for people who are in the top 40% of income earners. That means only households earning at least $75,000 a year have a right to housing they can afford. This is housing as a privilege. It's not housing as a human right. Or the Ford government's inclusionary zoning, which so many people fought hard for, believing something was better than nothing. This approach to so-called affordable housing lets the investor-driven and increasingly investor-controlled housing market define what is adequate housing as less than 80% of market rates. I did the math, and it would take 2.5 people working full-time at minimum age to be able to afford a one-bedroom apartment in Waterloo. Is this adequate housing? No. This is not human housing as a human right. So we can't rely on the provincial government's drive to build 1.5 million homes by 2030 to provide adequate housing for the citizens of Waterloo. It's up to us, the citizens, the taxpayers of Waterloo Region, to build and support adequate housing. And it's your job, councillors, as our elected representatives, to convince us we need to do this. We need your leadership. Now, attending ACORN meetings has taught me how our profit-motivated housing industry is creating homelessness day after day, right before our very eyes. So we need rent-eviction bylaws. We need rental replacement bylaws. We need to protect existing naturally occurring affordable housing. And so I'm really pleased that the region recently enacted enabling legislation to pave the way for municipalities to offer property tax exemptions to the owners of affordable rental housing. So I want to thank you for doing that. That's leadership. But if there's one thing missing from this report, it's the stipulation that all new housing built and all existing rental housing must be sustainable and climate friendly. Building green buildings, meaning net zero buildings, will make housing affordable over the long term. So we must also retrofit existing housing, especially naturally occurring affordable housing, to the highest possible standards. Because reducing building greenhouse gas emissions will mean long-term savings on utilities and building operation costs. It locks in affordable housing. If we reduce our reliance on fossil gas, what some people mysteriously call natural gas, we will eliminate many cases of childhood asthma, respiratory diseases, strokes, and many other ailments, saving us thousands and millions of dollars in healthcare costs. So implementing green development standards is a way to ensure that all housing will be economically sustainable and affordable over the long term. And this is a way we can prevent future homelessness.
Thank you, Kay. I don't see there are any questions. Thank you for presenting.
Thanks.
Matt Harrigan. Welcome, Matt. You have 5 minutes.
Good morning, council members. My name is Matt Harrigan, and I'm a program manager with the Canadian Mental Health Association in Waterloo, Wellington. CMHA is a full care system for those with mental health and substance use health needs. This includes our early psychosis intervention programs, our intensive case management teams, our seniors mental health services, and our crisis services in Here 24/7 and Impact. Our mission is to build a community where everyone has what they need to achieve the quality of life that they desire. This mission is in line with the region's vision, in which everyone has the opportunity to live a good life. In order for both of us to realize this work, we must put forth considerable efforts to end chronic homelessness in Waterloo Region. Along with other service providers, lived experts, and regional Waterloo staff, CMHA has participated in the development of a comprehensive plan to end chronic homelessness. CMHA endorses this plan and believes it's an important step in addressing the short and long-term needs for appropriate housing and health supports in Waterloo Region. My program, which is the Flexible Assertive Community Treatment Team, supports individuals living with persistent mental health diagnoses that includes schizophrenia and bipolar disorder. Within the last 3 years, 1/5 of our caseload of clients have been precariously housed or chronically homeless. These individuals have accessed shelters, tent encampments, the Herb Road cabins, even sleeping near our office downtown because they know it's a safe place to be. Many have ongoing hallucinations, delusions, unresolved trauma, and other concurrent and medical issues, all of which impact their ability to secure and maintain housing. For these folks, their first mental health crises often occurred in their teens and their early 20s. For many of us in this room, at that age, we were learning how to budget our first paycheck. We were finishing school, we were learning to live on our own. For those with psychosis, they may not get that opportunity for many, many years and lots of recovery before that becomes an opportunity again. We know social determinants of health, income, access to services, and our physical environments are important factors in keeping us well. With the growing complexity to meet these determinants and the limited resources to do so, we need to more effectively collaborate and integrate homelessness services with healthcare. A strategic focus area in this plan is building system bridges, largely via the whole of community leadership table. That includes regional Waterloo staff, lived experts, equity-owed groups, and service providers, including CMHA. I appreciate that healthcare funding is more than just a local issue, but through endorsing this community-led approach, it provides a platform to engage in important discussions that address barriers to healthcare access and improve system navigation. Lack of affordable housing and supportive settings also continues to be major obstacles in transitioning our clients out of homelessness. Therefore, another strategic focus area in this plan is to advance equitable housing. It's seeing housing as a continuum, just like we see mental health recovery, and embedding housing first and human right principles so that housing and treatment supports are together as one. By increasing the stock and the variety of housing options, we can match those with the highest complexity of needs with the appropriate level of supports to promote skill building and recovery. For some in the short term, creative projects such as the Herb Road cabins and increased shelter beds are essential for our staff to be able to engage clients in their spaces and support transitions to longer-term housing options. We know that when individuals are safe, supported, and have timely access to healthcare services, it provides the opportunity to heal and flourish in their mental health recovery. Being a part of this co-creator group has opened my eyes to the complexity of our housing problem. I saw the value of having different voices to ensure all angles of the problem were identified, dissected, and formulated for solutions. I can tell you from being in those rooms, many individuals and organizations are willing and ready to support an end to chronic homelessness. But none of us are going to be able to solve this problem alone. It will take a whole community and, of course, the region's support to reach a functional zero chronic homelessness by 2030. This issue is far too complex and far too important to be carried out in silos. Thank you very much for the opportunity to speak this morning, and CMHA looks forward to partnering with you in this commitment. Thank you.
Thanks, Matt, for your presentation. There is, if you just want to remain there, Councillor McKay.
Thank you, through you, Chair. Thank you for your presentation today. It's really, I think it's really impactful to hear, organizations like yourself and some of the others who've come forward to say how they support the plan, particularly given your subject matter expert of mental health. My question, though, is, what I found particularly, I mean, there's a lot of stuff in the report that's very interesting, but one of the things I think is particularly interesting is also about how it's shifting and fundamentally changing and transforming how staff will work and how the system will work. And I'm just curious if you see that there's change like that that's also needed from your end of it as well, or like how will your systems, because I see you as one of the key players in this, in addition to the healthcare sector and that as well. But so are those? Do you see that your organization needs to adapt and change as well, or what does that look like?
Yeah, I think it's a few things. So as an organization, we are seeing a considerable amount more substance use within the individuals that we're supporting. And so part of what we're having to shift and do professional development-wise for our staff is more education around substance use and how to support somebody through that recovery and that interplay between mental health and, at least for our team in particular, psychosis. And we do know that substance use does have an impact to the symptoms of psychosis that somebody experiences. So I think both as an agency, we're looking at how do we shift in terms of supporting individuals. We're seeing more complexity in terms of housing. So a lot of our individuals, whereas before you weren't discharged out of hospital unless you had housing, people are being discharged to the street or shelter just because they're so overworked in the hospitals. We're seeing more complexity in terms of multiple diagnoses. So on our team, you may have psychosis, but you also may have a developmental disability where we need to partner with the DSO. You may have a concurrent issue where we need to partner with RAM, the Rapid Access Addictions Medicine. So it's more complexity in terms of what we're seeing, and we're having to partner a lot better as well with our service providers that we work within the healthcare system. So our hospitals, DSO, Traverse, our addictions partners, it's starting to take a village, especially for those that are the most complex within the community that we support. We can't do it alone from a healthcare perspective, and we can't do it alone from a housing perspective either. It takes working with our mental health and justice team and our justice folks, our housing partners, all of that. So.
Thank you for that. That's really helpful to hear. And just a quick follow-up. A stat I heard when I was on the Parents for Community Living Board was that 13% of people who are experiencing homelessness have a developmental disability. Is that still accurate? Is that sort of the ballpark range? I just mentioned it because you brought up that issue, because I mean, if 13%, I mean, that's extremely high if that's the case, in addition to the acquired brain injury element of it as well.
It would be a good question, I would think, for Developmental Services Ontario. I think anecdotally from what I've seen on our FACT teams and what I hear from the ACT teams is we are seeing more complexity. So we are seeing more individuals with that dual diagnosis is what we call it. So that psychosis or that severe and persistent mental illness along with a developmental or an intellectual disability. So the challenges in that is kind of like what that gentleman was alluding to, building those independent living skills it becomes an important piece, and also just the variety of housing that you need, right? So many of our folks won't be able to just jump from shelter right into an independent apartment. Some can, but some are going to need that transition through that supportive setting into something where it's a bit of both, where you might have a little bit of independence while also having on-site staff support and kind of transitioning through to an independent apartment, knowing some are going to need that supportive setting longer term anyways. Yeah.
Councillor Preventative.
Thank you very much, Chair Urban. Thanks for coming in today, and I think some really important points, particularly in context of supportive housing and the need for the supports to go along with that, because you're absolutely right. Depending on the acuity of an individual, the ability to make that transition without those supports will often only see them return back onto the street, which is not a good result for anyone. I guess my question to you is, coming out of the pandemic and in recent years with everything that's going on geopolitically and so on, we've seen the rise in incidents or, rise in challenges that people are experiencing around mental health to be quite significant. And I'm wondering if you can just talk a little bit about how that is taxing your resources and some of the resource needs that are going to be necessary in order to be able to support this housing work.
Mm-hmm. Yeah, I think similar to the housing, our healthcare and the referrals that we've seen come through for our services, and I know from chatting with our services partners as well, really rose during COVID. I know in chatting with our Director of Adult Services, our First Step Early Psychosis program saw a 300% increase in referrals from COVID. And so for us, in terms of the adult services, most of our referrals end up coming from the First Step program. And so knowing upstream that we've got a humongous amount of referrals coming for our early psychosis intervention that are going to transition to our programs, we are seeing a rise in referrals across the board. For my program, we don't have enough resources to get to everybody that's on the wait list. So folks are waiting a period of months to be able to get our supports. So it's definitely becoming challenging. And I know our CEO is working with local, provincial, federal partners to be able to advocate for more funding for mental health services, because for sure there isn't enough resources within the region to meet the demand.
Great, thank you very much.
Councillor Hunak.
Hi, Matt. Thank you for your excellent delegation today. For those of my colleagues who don't swim in the world of intellectual and developmental disabilities, could you just explain briefly what the DSO is and how that intersects with the work that you do?
Yeah. So Developmental Services Ontario. So, and I'll preface it, I'm definitely not the expert in that area. So there are folks that would be able to explain it better. But those services are available to individuals that meet a certain threshold for a developmental disability, both in terms of diagnosis and in terms of functioning. So for our program, although we do support individuals with developmental disabilities, we often look to partner with the DSO. And so within that, there's long assessments that you have to do with that individual for them to qualify for funding. But then with that, you get access to behavioral support workers, you get access to something called passport funding as well, which is you have a pot of money that you can work on goals that you might want to address, like leisure goals and other things that you can get supports for. So for us, it's really helpful to be able to partner with those, because we only work 9 to 5, Monday to Friday. And so having some supports to be able to address the developmental side of things. Is that
you did a great job. I just wanted my colleagues to be aware of the acronyms that you're using.
Yeah.
Thanks.
Yeah.
Thanks, Matt, for appearing.
Okay. Thank you.
Next, Nadine Green. Welcome, Nadine. You have 5 minutes.
Hello, everyone. My name is Nadine Green. I'm grateful to be here today to continue to shine a light on homelessness. I'm going to tell you a bit about myself, to let you know 3 things, 3 calls to action, which I'm passionate about, and ask for you to put your support and ask for your support for the recommendation brought forward today. For those who don't know me, in 2020, I was evicted from my Kitchener downtown convenience store for acting as a shelter. I met Ron Doyle, who wanted to launch a project to house people experiencing homelessness at his vacant event space, Lot 42. I have lived and worked at Ron's A Better 10 City in Kitchener for 4 years. We have housed and continue to house many people who cannot fit into traditional housing solutions. We have come a long way since 2020, yet I'm still very concerned about these challenges. Homelessness rates are rising across Waterloo region. The increase in youth homelessness is particularly harming. People on the streets have complicated needs, including substance use disorder and mental and physical health challenges. I'm proud to be part of the Lived Expertise prototyping group who created Appendix C in the plan to end chronic homelessness. Today, I'm here to support action in 3 focus areas from the PESH report, Appendix B. Focus Area 5, focus on preventing homelessness. Focus Area 2, center community voices. Focus Area 4, advance equitable housing. I want to begin with the areas of preventing homelessness. Action 52 calls for the creation of a youth strategy to respond to the unique needs of youth experiencing homelessness or at risk of homelessness. It breaks my heart when I see younger and younger visitors at a Better 10 City looking for a cabin. Because our residents must be at least 25, the most we can offer these young people is a meal and a washroom access before directing them to other services. Youth becoming homeless needs to stop now. My second focus is on supporting individuals experiencing chronic homelessness. Action 2.4 calls for the establishment of an annual funding application and review process for community organizations across the region to support emerging ideas and prototypes to respond to homelessness. We need a small pool of money so that we can be able to quickly help people in dire strait. Perhaps it's buying a pair of shoes, winter boots for someone living outdoors and only wearing running shoes, or getting some tarps for people living rough, Victoria and Weber, or anywhere they are, to help to keep them dry from the rain. My third focus is on permanent housing and options. Action 4.3 calls for the creation of new permanent, affordable, and supportive housing to meet current and future housing needs to end chronic homelessness. Housing solution needs to ensure those with the greatest depth of needs are supported to stay housed. Not every type of housing fits everyone. There is a place for tiny home communities as a permanent housing solution. Council, I urge you to support this plan to end chronic homelessness. We need a lasting change in our region. Homelessness is a complex issue, and we need to keep tackling it piece by piece with your support along the way. I am going to continue to live in my tiny home at a Better 10 City to advocate until all the people have housing and food in our community. I invite you to visit a Better 10 City, and I'll give you a personal tour. It takes a village. God is working, one love. Thank you.
Thank you, Nadine. Now, I have a question. I understand Shannon, who was going to be,
Yes.
was not able to be here.
And I'll read a speech for him. He asked if I could.
Yeah, okay.
If it's okay.
All right, so first of all, there's no questions for you, Nadine, so if you want to then share with us what Shannon was going to present.
Yes. So Shannon wrote, my name is Shannon Burt. I reside in Kitchener. Waterloo region is incredibly successful at fostering opportunities for most of its population, but there is a group that is left behind. I am a part of that group. On Friday, November 26, 2021, 1 month before Christmas, the region of Waterloo ordered a bulldozer to come to my home and destroy it. My shelter, my possession, everything. I was already homeless. I became houseless too. My 4 friends and I had nowhere to go. Obviously, back in 2021, there was not a human rights approach to encampment response, nor was there awareness nor capacity of various types of housing. It was a time when health-related coordination wasn't done well. Today, you're being asked to support a plan which will address these issues and more. Do the right thing. Get behind this plan to end homelessness. Do things with a human rights approach. Improve health support and get more housing for people experiencing homelessness. Thank you.
Thanks, Nadine. And I see no questions as well related to what you shared for Shannon. Thanks for being here.
Thank you so much.
Our next agenda, or our next delegate, Julia Nickham, has withdrawn. However, we have a late registration in Gavin Moore, who I think is in the audience. Gavin, are you on? Yeah. Gavin may have left. All right, and I understand that Heather Mann is now here, who was registered earlier. Heather, welcome. You have 5 minutes.
Thank you, and apologies for stepping out to the washroom at the wrong time there. Good morning, Council. My name is Heather Mann. I'm a local teacher and a social scientist by background. I'm also a resident of Waterloo and a member of Waterloo Region Community. Today is an important day with the presentation of the plan to end chronic homelessness. I want to recognize the dedicated effort that has gone into creating this plan, commissioning the report, and involving lived experts in the research behind the report required a leap of faith, and I commend those involved in doing so, including the co-creator panel, the Region of Waterloo staff, and the lived experts prototyping group. I'm sure that the work behind this report has not been easy, yet here we are with a plan full of insights and concrete actions for moving toward the aim of ending chronic homelessness in Waterloo Region. Given my limited time today, I am here to support the plan, and I'd like to focus my remarks on one of the shared principles, rebuild communities and involve the capacity of the whole community. So in November of 2024, I got involved in the provincial by-election for Kitchener Centre. I grew up in Kitchener-Waterloo, but had lived away for 15 years and only moved back in September. So I was still in the process of becoming reacquainted with the community at the time. And in canvassing door to door, I heard directly from residents of Kitchener on issues that concerned them, including housing and homelessness being prominent issues of concern. Speaking with some of the others involved in the by-election, we thought about and began to talk about organizing a community dialogue around these issues. And so we asked the Social Development Center and Ray of Hope to partner with us on that and began to spread the word. And on March 9th, 2024, over 100 people came together at Ray of Hope to talk about this critical community issue and how we might move forward. The dialogue brought together community members from various backgrounds, including individuals with lived experience, academic experts, developers, those in social services, grassroots organizations, and political representatives from federal, provincial, and regional governments. And I want to thank Chair Karen Redmond and Councillor Hunick for attending. At the dialogue, we engaged with the question of how we could generate hope for turning the tide of homelessness. Participants generated many ideas for concrete actions to move the dial forward and shared about what gives them hope. One table group shared, community events like this bring us hope. Homelessness is a wicked problem. It is the outcome of many complex intersecting factors, which makes it very challenging to address. As a result, when it comes to homelessness, it is easy to point the finger and blame other parties for failing to address it. In my mind, a whole of community approach encourages us to point the finger at ourselves and to each ask ourselves if we are doing our part. Yes, we will need support from all levels of government. So how can we band together to call for this support? As I see it, our success in addressing this problem is intimately tied to how effectively we can work together. There are so many amazing people and organizations in the community, and there are new groups coming to the table. So in addition to advocacy groups like ACORN and the Unsheltered campaign, there are faith communities such as the new Supportive Housing Advocacy Group from the United Church and the Ahmadiyya Muslim Organization. The community dialogue on March 9th is evidence that within Waterloo Region, there is a real and deep desire to turn the tide of homelessness. It showed that the community is willing to work together to address this wicked problem. The plan to end chronic homelessness talks about redesigning governance to be in community, by community, for community. This is a worthy and ambitious task, and I'm excited to see what it can look like going forward as the plan is carried out. The plan states, by leveraging the collective intelligence and experience in our community, we will solve this community problem. And I would say, let's work together to build that leverage. Thank you.
You still have 3 seconds. Thanks, Heather.
Thank you.
Our next delegation is David Alton with some Heather, Shar, and Fitsuma. And you have 5 minutes.
Thank you, Chair and Council. We are here today as the appointed delegation of the prototyping cohort to frame for your consideration the lived expertise prototyping report found in Appendix C. We were supposed to be joined by Charlie today, but unfortunately she is sick. But it is her birthday, so if you'll indulge me in a little moment of happy birthday, Char. The prototyping cohort is a gathering of lived experts, mutual aid representatives, and advocates who met together for the past year through the Social Development Center's prototyping process, a core stream of the plan to end chronic homelessness. This process has created spaces for regional staff and other stakeholders to better understand the impacts of status quo, make visible the barriers of change, and cultivate spaces for transformation and action. And this is through working directly with lived experts. The prototyping cohort calls this the system seeing itself, or the system seeing itself enough that it finally wants to change. I want to emphasize the importance of lived expertise and honor the significance of its centering in this plan. Lived experience is, simply put, the experience of being harmed by the status quo and being harmed by the region. Lived expertise pairs that experience with advocacy. Listening and learning from their voices is not something institutions like the region are trained and prepared to do. There are many deep-seated barriers such as stigma, a lack of political will, bureaucratic fragility, and unconscious bias that need to be overcome. That is why it's so important that the prototyping process continues and that the foundation being built in this iterative, experimental, responsive laboratory gets replicated into deeper transformation ahead.
I am a mother who experienced homelessness with my daughter when she was only 5 weeks old. Yes, this is a time in life where support, stability, protection, and housing matters. Article 25.1 of the Universal Declaration of Human Rights states, everyone has the right to a standard of living adequate for the health and well-being of self and family. Our definition of chronic homelessness recognizes people experiencing homelessness are rights holders, and their agency must be respected while our region holds a duty of care for their housing needs. Housing First prioritizes adequate and accessible housing for all people. It is not a worthiness competition. There are no requirements to complete forms, treatments, or forced participation in any programs that create barriers to shelter. And of course, that doesn't mean we leave supports behind. They are offered rather than mandated for eligibility for help. There are, just a minute here, recognizing human rights and implementing housing first are truly symbiotic in nature, not symbolic. Our calls to action provide achievable, concrete steps to realizing both goals while respecting security of tenure as defined by the Office of the United Nations High Commissioner on Human Rights. The region of Waterloo should comply with human rights law at minimum if you truly desire to achieve functional zero homelessness.
I want to further emphasize how the lived expertise prototyping report functions as so much more than an appendix to the main staff report. In what little time I have left, I will touch on just two elements of the prototyping report that are important to highlight in the context of the larger planned end chronic homelessness: the definitions of key terms and one specific strategic focus that was generated by the lived expertise cohort. Many terms were consistently defined across both the lived expertise prototyping report and the staff report. However, the lived expertise report includes terms that were not defined by regional staff in their report, despite their frequent use in the plan. Key terms like agency, affordability, and informed consent are peppered throughout the staff report, and these are vital components comprising the plan's human rights approach. It is the lived expertise prototyping group's detailed definitions of these terms that, as well as many others, that enhances their practical application and articulates the values and principles underpinning and guiding this plan. Councillors and residents should not view such plainly stated differences between the reports as a negative thing, but rather an indicator of integrity and transparency. I'd also like to draw attention to the strategic focus on climate and extreme weather planning. This was a focus that was included in both reports, but was specifically generated by the lived expertise group. This speaks to the value and a testament to the effectiveness of this process. This prototyping report is not merely an addendum, it's a critical document that integrates lived and living experiences and the perspectives of those most impacted by homelessness. I encourage councillors to engage deeply with the lived expertise prototyping report as it unpacks important details outlined in the plan to end chronic homelessness. Thank you.
Thank you. If you just want to remain there, we have a few questions on Councillor Bunak.
Thank you for that excellent delegation. For those who don't know, because of my visual impairment, I access all council reports and documents through a screen reader, which I'm very thankful for. It makes a lot of things accessible to me. Sometimes funny things happen. For example, as I was reading the Plan to End Chronic Homelessness report and all of its excellent appendices, I kept hearing Ellie, prototype, cohort, and I kept thinking, who is this amazing Ellie person, and why don't I know them? And it wasn't until reviewing last night that my council support person indicated that it actually says LE, which stands for Lived Experience Prototype. So not only a thank you, but also an insight that we really need to give thanks for the voices of lived experience that we have, and we really do need to continue to center their wisdom. And thank you to everyone who made sure that all of the reports were accessible. Thanks.
Councillor Deutschman.
Thank you, Chair Erb, and I thank Councillor Hunick for her comments. First of all, David, thanks for letting me know. I was going to ask where Shar is and extend my hello to her, but also, Shar, happy birthday. Happy 29th. So two questions that I have, David. First, thanks for the opportunity to speak with you on the weekend, for taking time out of your weekend to have a chat with me about this document. It is a social document and something you can appreciate 16 people, well, most of the 16 people receiving for the first time not too long ago, working to digest. So I thank you for that, and heard your comments on CBC this morning. They were very good comments as well, so appreciate that. So I just wanted to clarify, though, as I'm going through this, the lived experience document is an appendix to our package. And I'm just trying to understand. So we have a document that, is the plan, and then we have your document, which is substantial and comprehensive. And I'm just wondering how the two work together because, for example, I noted that you had a section focusing on preventing homelessness, and there was items 4 and 5, which caught my attention. And I certainly appreciate these concepts. But I want to ask you specifically on those 2 items, for example, were those incorporated in the overall plan as you read the overall plan to end chronic homelessness?
So to the first part, I would say that,
You're on.
Okay, hi. So to the first part, I would say that the plan to end chronic homelessness is also appendix. Both the plan to end chronic homelessness and the lived expertise report are equally appendixes of the staff report. And so this is really to emphasize that the two are fundamentally in discourse and dialogue with each other and should be really, and the nuances between them, yes, some definitions are shared, some definitions are different, some calls to recommendations are shared, some are different. And we really wanted to highlight that because, as we said, this is a living document and this work is going to require us working through those nuances, and we wanted to not censor the voices from the lived expertise prototyping group and let them act as a benchmark of some really concrete objectives that would make a meaningful difference in our community that the plan can enact through the coming years. I don't have the plan on my hand. Could you read out the 2 that you wanted me to comment on directly?
Sure, yeah, and actually, your question actually would have led me to this supplemental on that, was that in item 4, it talks about, I'm just getting to it here now, it says, endorse a tenant protection package, which includes a rental replacement bylaw, rent eviction bylaw, some common definition, human rights approach to evictions, and in number 5, it was a tenant rights hub, which had a third-party property standards assistance team, an eviction prevention team, a tenant organizing team. So I was trying to see if those specific items were located in the appendix that included the plan, and I really couldn't identify those. So that's why I was just curious, because we've got your group, we've got this plan, and how are the two integrating with each other?
So I think that's something you'll notice, I think, through a lot of the plan is that the plan to end chronic homelessness and the lived expertise prototyping report, a lot of the calls to action are very concrete. And it's not that the regional staff weren't thinking concretely. They had a whole list of 100 recommendations that were quite concrete. And so there was, because of the nature of this work, things got a bit higher level. But the lived expertise working group, lived experts are fundamentally at a very concrete level. This is their lives, and these are the things that are directly impacting them. And so they wanted to communicate these things in very concrete ways. And I would say that they, definitely regional staff have read this, have listened to this. We've had lots of conversations about this. We've been liaising a little bit with the Building Better Futures process as well on how that can embody some of those elements. But for the implementation of that, the 2 documents exist in dialogue. Regional staff and regional council, I think, have the ability to move forward on specific calls to action in the lived expertise prototyping report that they feel are exciting. I think it was more our regional staff's discretion to try and hold their recommendations at a bit of a higher level than the lived expertise report because of all the nuances that they're trying to hold at the same time.
Yeah, and thanks for that. And that's why I started trying to sort out what exactly will we be committing to with a vote today. Oh, someone going to follow up on that? Sorry.
Yeah, I just wanted to add that I'm an adult educator, so I just wanted to suggest that you look at the appendix and see our very concrete recommendations and play the game of join the dots. And it might be really useful to take a line as you're working through the documents and see where they apply in the larger document as those concrete steps.
Well, thank you for that. And if you can point me, I'd be most appreciative of the help. If you could point me to where in our document we talk about a property standards assistance team, I would be most grateful. So I appreciate that.
Right now, it just sits in the.
Yeah.
Okay, so I think you've had a question and a follow-up of Councillor.
No. It's, Chair, ask for clarification on my first question. I have my second question now.
Okay, let's get at it then.
Thank you very much. David, so just a final question. you and I spoke about this, the philosophical nature of this document. And I'm just wondering if you could comment on, if you could appreciate when you're presenting a document to 16 people that represent various parts of the political spectrum, left, center, right, that receiving this for the first time, it might be a difficult time achieving consensus on this document or moving forward on this document?
Yeah, I imagine it's going to be a lot to hold as a council that's representing a whole lot of the community. What I will say is that the prototyping process is not going anywhere. So if council would appreciate even more like direct conversations with the people who created the report, like I believe we can work, like we're part of the core team in the Planning and Chronic Homelessness. I believe we can work with staff on further opportunities for dialogue. And I wish you the best today. I would say, you know, I know you have a lot of political differences that you're probably trying to juggle, but ultimately what the prototyping court really wanted to emphasize is things around the human rights approach, that some things are not a matter of opinion, some things are a matter of right, that there's a fundamental need to provide people adequate housing that we are not doing, and that, as Dr. Pinn mentioned earlier, municipalities are becoming increasingly liable for. And so we hope that the region through this document can kind of get ahead of that, prioritize setting a foundation of the rights, and then, you know, you can work out the political differences a little, I think, a bit secondary to that.
Good. Thank you, David.
Councillor Schatz?
Thank you, and thank you for presenting today. We've heard a lot of different issues that all sort of feed into this problem of housing. One of the things I think I heard today is that the physical space, and I can appreciate that the physical space is very important. So if we can set that aside and agree that, yes, we need physical spaces, what's the, if you can pick one, what's the most important service that would help alleviate this problem or help us move forward? Because obviously we can't solve all the problems all at once, and we don't have enough money, and we won't have enough money to sort of snap our fingers and make it all happen.
I actually think that's where the kind of the items that Councillor Deutschmann was focusing in on around like the tenants, advocacy tenants, right, policies are really tangible things that both upper and lower tier municipalities can work on, really to push prevention a lot further. Right now, traditionally the primary prevention tool has been rent supplements, and I know through the fee-for-service process, the region's now also supporting eviction prevention work, but this kind of tenants' right hub policy thing that Councillor Deutschmann was mentioning that's in the lived expertise report, I think really takes holistic prevention even further. And I think we heard today that prevention is a key, very critical as a place to start.
If I could just follow up to that. So that's still working within making sure that, excuse me, that everyone has a physical space. And maybe the other pieces aren't as important, but are there other services, other supports that, as someone with lived experience, that you've seen that are really key to making this whole thing successful so that people can thrive in those spaces, assuming we can get the spaces?
Yeah, I think, I mean, we've heard a lot today about things around mental health and around things around addiction supports. Those are also very important, but I think those two things fundamentally are, I would say, symptoms of the bigger issue, which is dehumanization. And which is like this culture where people are seen as not worthy, where people are seen as less than, and then as soon as you hit, you know, some complications or some traumas in your life, that all of a sudden you are no longer of value, and then that's where mental health and addiction crises start. And so I think if the, like on that kind of social side of things, if the region taking strong leadership, doing emphasizing advocacy and public education to really tackle stigma can really help push those things that are driving people into those really spiraling coping mechanisms. I think that's one of the big key social pillars is this kind of anti-stigma work.
Thank you for being part of the process and being here. That goes a long way to helping that exact problem. Thank you.
Chair Redmond.
I just have something very quick to add. As a woman who had to be on OW when I was parenting, and when I became homeless, because it was because I was on OW that I became homeless, because the worker told me that I was overhoused. So I was overhoused by approximately $30 to $40. So I think it is really, really important that everybody start to question the provincial applications of this system to understand where to mobilize your efforts as regions and communities to ensure that the province changes the way it does things, because no one can actually get housing at 30% of their income on the level of OW assistance that occurs right now when people are vulnerable.
Thank you, Chair Urban. I will try to restrain myself from making editorial comment, but there's over 60 people in this chamber, and you've been here all morning, and you're a mere representation of other people who have been involved. And I would tell you, I haven't heard one delegation that doesn't share common cause, which is ending chronic homelessness. We wouldn't be here without all of you, staff included, and all of the community members, so heartfelt thank you. I don't think it's where we fall on the political spectrum. I think it's competing needs. And there are many, many other issues that require not only the attention, but the leadership and the funding that the region of Waterloo is able to provide. This is a very, very important issue. A couple people have talked about it takes a village, and it absolutely does. This is a step forward in a longer process. So even people that have commented on other elements that they would like to see amplified, I so appreciate your characterization of having 2 appendices to this report. There's so much goodwill here. We're not going to get this perfect. We are going to continue to go forward. So my real question is, you sound optimistic, you're obviously invested. How do you see your role continuing to go forward as we try to navigate how to grapple with this very challenging, complex issue?
Yeah, I think if you asked any advocate or lived expert or even any regional staff, like, this is very hard. Sometimes the conversations, there's a lot of the tensions that we're trying to navigate, and then when we're trying to sort out solutions, it all like blows up, and there's a lot of dynamics we're all trying to work through. And so I think there's going to be space for bridge builders like us for a long time in this work, to be trying to help create space to empower staff and counselors and other people in the system. How do they, see these things, listen to these things, see their place in these things, navigate all the many, as you said, competing interests you're holding, to try and help support for those, that side of things. And then for the folks on the ground, every minute there's more and more harms and things happening in the community. So it's always we have to be very responsive to everything, to where we are being called from the community. And so I think we will continue as a bridge builder to try and help support and uplift, where the calls are coming from the community, and to be helping regional staff and other stakeholders. How do we come down and listen and learn and actually make some changes? So we're going to be building bridges at least to the end of this year, and hopefully longer through this work, because we find it very meaningful.
Councillor James.
Yes, thank you through you, Chair Erb. Thank you for submitting this piece to the plan. I will tell you that it was an absolute breath of fresh air to read this. I think you have all modeled something in this report that I don't know if is really recognized, and it's about the language and how important that is. And it is an absolute tangible, geared to income instead of affordability. The way in which we use language dictates how we move forward, and I think you've modeled this in this report by outlining gaps in the terminology. We're stuck in terminology from 1940, 50, 60. We're going to continue with the same level of thinking based on that language. So I do have some thoughts just around the education piece. And I know you all are part of the co-creators group, and conscious of where the education, the school boards and that element fits in with this. Something I know that's possibly for once this may get approved going forward, but really that education piece. But I do want to commend you for the calling out of the language that needs to change. As this is a systems approach, and we know we need provincial government and federal, you know, as Chair Redmond said, I recognize who's in this space right now and who's not. And that's also indicative of the way we need to move forward too. So thank you. That's all I'll say for you guys.
Councillor Preventative.
Thank you very much, and thank you to the three of you for coming in and for the work that you're doing. I'll echo the comments from Councillor James. You know, I know that some of you were involved with the City of Kitchener's Housing for All strategy and you know, strongly articulated the needs around the human rights approach there, and I'm certainly pleased to see you doing the same today, and not surprised, to be frank, and glad to see that it's worked its way into the document. I mean, one of the things we heard from several of the delegations is the importance of it being a whole of community approach, and that needing to also include the area municipalities. And I'm just wondering if you can talk a little bit about that from your perspectives, how important that is in terms of the work that's being proposed.
Yeah, I mean, I think as Dr. Pinn noted earlier, there's a lot of these elements, like all of these, for example, our tenant protections, are things that are very in the lower tier municipality wheelhouse, as well as, I think, one of the things that lower tier municipalities, I think, really have an advantage in this work is being very, like, almost like intimate with communities, like whether it's parks, whether it's recreations, events. And I think that's where municipalities have a lot of, lower tier municipalities have a lot of ability to really push the shift the narrative piece as well. You know, people really listen to their mayors, people really listen to, you know, these more closer to home touch points. And I think there's lots of opportunity there. And as you're right, like through our other part of our consulting work, we are working with the City of Kitchener's planning department, and we are every day we find new opportunities through that on how a lower tier municipality can learn and adapt and grow from lived expertise. So we're always happy to work with any lower tier municipality who wants to tap into this kind of knowledge and tap into this type of work. And we really wish you the best as you champion this work in your communities and beyond, because you have really powerful voices and positions and respect.
Thank you very much.
Councillor Deutschman.
Yeah, thank you very much. I think that most of my questions have been answered, so I appreciate the work that you all have done, as you know, and in my conversations with you. And we do have a heavy load to discuss today. Actually, could you just remind me, over what period of time was the lived experience involved in the development of this plan?
I would say from even before its conception, really. The regional staff have been learning, and like, for example, the work that City of Kitchener's Lived Expertise Working Group did, I think, helps pave the way to soaking some ideas, both in the Social Development Center, but I think also in regional staff. We talked to Regional Council for the interim housing solutions, which then this plan came from. So you can see even before then, but then once the RFP was out, the Social Development Center, we put our name forward, and as soon as the regions accepted, we brought in a cohort of lived expertise consultants right away. And so that would have been from at least March of last year.
So March of last year?
Yes.
Yes, and just the last question I have for you, David. I posed this earlier. The difference between chronic homelessness as a target and functional homelessness as a target. What can you tell me about that? Because I see we are proposing in the plan, which is 3 people or 0.1% or what have you. Just if you could just help explain that one for me, because it's a new concept to me.
Yeah, and I'm sure Fitzim can help me here if I get a little lost. But this is where I think this beautiful piece of these two appendixes and dialogue comes in, because you'll notice very quickly that the lived expertise cohort, they defined both chronic homelessness and functional zero homelessness different than the region did. And it's because the regional staff we're trying to accommodate other pieces in their decision making, but I think it's important to hold these two in conversation, because the one that the plan has is around 3%. The one that the lived experts, when it comes to functional homeless, the one that the lived experts talk about, it was like literally it was if anyone in the community does not have access to adequate housing. Like it really expanded the picture. So for the lived expertise cohort was very interested in reframing how we think about chronic homelessness to talk about people who are couch surfing, living in cars, living in abusive situations. I would even say, to Councillor Craig's point, who are living with their parents, although they're not experiencing the same harms, there is the idea of like, we have to change how we are thinking about homelessness to be far broader. And I think the lived experts were very passionate about that in terms of reframing how we think about chronic homelessness. And then how we think about functional zero, then it's less about a percentage and it's more about actually like what is our rate compared to adequate housing. And Fitzim, if you want to jump in a bit.
I don't have much more to add to what David said, other than to point out that the lived expertise group was very specific about grounding these definitions locally. We're pulling from national frameworks, international frameworks for these definitions, but that was something that came out loud and clear in the lived expertise group, that to do this plan well, it needs to reflect the specific needs of our community. And so that was something that was reflected in the prototyping report.
Also,
Thank you.
Local
Yes.
definitions go beyond the basic templates that go up the charts of legislation. So you're not trying to undermine the actual legislation. You want to actually support it, potentially go above and become leaders in that realm. I think that's really important to remember. Functional zero is not about every person all the time or a dead date where all of a sudden, oh, we achieved functional zero, now we can move on to something else. The reality is that homelessness is on a continuum, and it's important to remember that when you are hidden homeless, you're not accessing many of the services because sometimes you're trying to stay away from stigma and you're trying to actually move on. So when you do finally come into the system that then tabulates you, that counts you as actually homeless, those numbers are much lower. You're also coming in after potentially 3 years of couch surfing and that sort of thing. So I think that's really important to remember.
Thank you.
Great. Thank you.
With my colleagues' consent, we've had a couple requests for a bio break, and I'm wondering, rather than taking a bio break and then lunch, which was scheduled for 12:30, if we were to take a lunch break now for till 12:30 and then come back, if people are in agreement with that. For the benefit of the audience, I know we have a bit of a momentum going right now with the delegations that we've had and then getting into the report. However, we do have another piece of our agenda that we need to consider before we get into the presentation by staff. So, and we do have 3 other committee meetings this afternoon as well. So I'm going to suggest that we take a half an hour break for lunch if everybody's okay with that. My apologies to those that have been waiting patiently. There's a cafeteria if you want to get a quick bowl of soup or something of that, and we'll eat fast and be back as fast as we can. We don't need a motion. I'd like to call this committee meeting back to order. And excuse me, we're on to the consent agenda item, and if you want to remove any item from the consent agenda, please indicate so now, as we'll not take any questions on consent items unless items are requested to be removed to the regular agenda. The item listed on the consent agenda will be dealt with in one motion. Is there any item that you wish to have removed from the consent agenda item? Councillor Shant.
Yeah, there's just one item on it. I just want to make a brief comment on it if I could.
Okay.
Do you want me to do that now?
Sure.
Yeah, I think the community paramedicine program is an example of some of the things that we've been talking about all morning in terms of upstream, downstream, getting to the root of some of the problems. And so I just want to thank our paramedics for their work in that regard, and am happy to see it continue.
Thank you. And are you happy to move it?
I am happy to move it.
Okay, and is there a seconder? Councillor Fox, another question or comment? Oh, okay. All those in favor, if you'd use your e-scribe button to indicate so, please. That's been carried. Thank you. Sorry.
So yeah, just one question, because I think I'm recognizing that we're obviously running really late. And I'm not sure how many people may be in the audience for subsequent meetings. But I think at some point I sent an email to Chair Redmond during the lunch break. I think we need to figure out the rest of the day, because a number of us can't stay long tonight, and right now it's pretty clear that we are going to be, and we have some caucus sessions that are, that I think, important, and so wondering what the thinking is around this stuff, so we can let delegations know if there are any here.
I think there is, we have 2 delegations for planning and works, is that right? One, okay. And is anybody here for planning and works now? That's start at 2 o'clock, yeah. So has there been any communication then between Chair Redmond? Do you have any advice here based on Councillor Vanvik's concerns?
So I appreciate Councillor Urbanovich bringing this out. I had a meeting during lunch, so I wasn't part of the conversation. I think that we're probably looking at going till at least 4 o'clock with this meeting, and wondering if council is amenable if we would put our closed caucus meeting directly after this. I've checked with the clerk. Have we been able to reach the delegation at the subsequent meeting?
No, but we can send out an email now if that's council's wish and direction.
So I would suggest that it's been a really good discussion this morning, and again, really appreciate people who have lasted in the gallery to listen to this, but if we could maybe move forward with the rest of this meeting and then go into closed and then see what the time is at that point in time. Can we just have a show of hands? Are there people that cannot stay past about 4:30?
5:30.
So we've got 4. 6 o'clock, yeah. So I think there's a little bit of flexibility. So if council is amenable to that and we can reach the delegation, my suggestion would be we finish with this meeting, go into closed, and then see how much time we have between then and 4:30 when it sounds like people have other obligations. I'd look to the clerk to see if that's amenable.
Yeah, that works for us. We can reach out to the delegate for planning and works now, and we can just move the closed motion at the end of CHS here to go on into closed.
Okay, heads are nodding, in agreement, not in being tired. Okay, good. All right, we are on to number 7 on the regular agenda, 7.1, the plan to end chronic homelessness, the final report. Commissioner Sweeney, we'll let you introduce this.
Thank you, Chair Erb. My original comments were good morning, Regional Council, but obviously we'll change that to good afternoon, Regional Council. This is an important day for us, not only as the region of Waterloo as an organization and a level of government, but more so for our community as a whole. After a year and a half of work that has taken place across Waterloo region, you have before you today a made in community, by community, and for community plan to end chronic homelessness. This represents the staff and the community's best foot forward as a response to your direction to create a plan to end homelessness across Waterloo region. It is a response to do that in a way that centers lived experience and the voice of the community we serve and the people who are most acutely impacted by homelessness across Waterloo region. It includes 30 specific actions that will allow us to address the challenges that cause homelessness, the challenges that people who are currently facing homelessness face, and the opportunity to prevent and support people going forward to a place where nobody in this community experiences chronic homelessness, where indeed there's a home for all. In and amongst those actions, there are specific commitments and recommendations related to the important and necessary work that has to happen with our area municipalities. There is a specific reference and commitment to addressing the challenges, the unique challenges that exist in our rural townships as it relates to chronic homelessness. And indeed, there are specific actions related to youth homelessness, seniors homelessness, mental health, addictions, and the absolute necessity of having wraparound care in supportive housing. All of those exist in the plan that is under consideration for you today. The plan to end chronic homelessness is the product of thousands of conversations. Those conversations have taken place around this council chamber with our local area municipalities. Conversations took place through broad public engagement last summer with thousands of residents, and conversations took place around a table of co-creators, many of whom took the time, the care, and the energy to come here today and share their support with all of you. They wrote this plan, their expertise and experience informed its actions. The process we undertook to walk alongside the community was just as important as the result. Trust is hard-earned and easily lost. And it is difficult to reestablish that trust once it is lost. Many of the co-creators who joined the table have a long history with the region, and some have little reason to trust government. This morning, you've heard some of the co-creators who delegated underscoring the complexity and the urgency of this issue. I would like to extend my deep appreciation and gratitude to the more than 40 co-creators who joined this journey. They took a step of faith forward with us and with each other. They set aside organizational ego, individual projects, and specific funding requests to come up with a plan that was created in this community, for this community, and by this community. Homelessness is not just a lack of adequate housing. It is an equity issue. It is a health issue. Homelessness is not the result of people's choice or failings. It is a result of systemic policy failures. We know that in this community, Indigenous peoples experience homelessness at a disproportionate rate. That exists and is true across communities across this country. This specifically is the result of ongoing colonization, the exploitation of lands, racism, and indeed intergenerational trauma, as well as government practice and policies. We did not get here overnight. This is a crisis that is 50 years in the making. This plan is a call to all organizations and all levels of government. Transformational change, system change must occur for the complex issue of homelessness to improve. It must include, and does include in the documentation before you today, an approach that combines housing first and human rights to move forward. Today, you will hear from several people who will provide you with an overview of the plan to end chronic homelessness. Peter Phillips, who's a colleague here at the Region of Waterloo, is our project lead and will introduce the background of this plan. Marjorie Knight and Jen Gordon, who are members of our co-creators, will add their voices as members of the community on behalf of the co-creators table and the community they all serve. And my colleague, Chris McAvoy, will talk about the challenges and the changes to the housing stability system that are absolutely necessary for us to move this plan forward. At the end, I will speak briefly to the funding, the advocacy, and the investment sections of the plan and our recommendations that we put forward to you today. With that, I will call my colleague, Peter Phillips, to the podium.
Thank you, Peter. Next slide, please. Our mission has been to unravel the complexities of chronic homelessness with the goal of understanding how to solve it. Chronic homelessness refers to individuals who are currently homeless and have been homeless for 6 months or more in the past year. With our most recent data, we estimate that 558 individuals in Waterloo region are experiencing chronic homelessness. The number of people who are experiencing chronic homelessness is growing significantly every year. If we continue at our current rate of growth, that number could reach more than 1,600 by 2028. Homelessness is a result of many factors, rather than a single cause. Poverty, traumatic life events, mental health, systemic racism, addictions, all can play a role. On top of these are intersectional factors. Many individuals face additional marginalization in their identity as 2S LGBTQIA+, Indigenous individuals including First Nations, Métis, and Inuit, those living in the rural areas, those with physical and developmental disabilities, acquired brain injury, racialized communities, refugees and asylum seekers, seniors, veterans, women, youth, and those coming from the criminal justice system. Next slide, please. Our goal of reaching functional zero by 2030 is to reach the point where we can prevent homelessness when possible and to ensure that when it does occur, it's rare, brief, and one time. Functional zero means 3 or less people experiencing homelessness sustained over 3 months or more in a system that is tracked closely with data and by name list. Functional Zero is monitored by 2 national organizations, Built for Zero and the Canadian Alliance to End Homelessness, both who have collaborated with the plan and have been at the co-creator table. Functional Zero is the major milestone on the path to ending chronic homelessness. Next slide, please. As Peter Sweeney has already mentioned, thousands of conversations took place in the community. We also examined practices of communities who are leaders in solving this challenge, like Houston, Texas, to name one amongst others. This work led to the creation of 7 strategic priorities, as listed on the slide. Create policy and system accountability, aligning with housing first, human rights, and gender equity approaches. Centering community voices, both lived experience and equity O groups to be at that table. Building system bridges within the housing stability system and across key sectors, with specifically mentioning health as key. Advancing equitable housing, addressing the diverse needs of people and ensuring accessibility. The focus on preventing homelessness, to move from reacting to more upstream actions. to change the narrative on housing and homelessness, engaging in the broader community to understand, reduce fear, and build empathy. Advocate and collaborate for broader change. The plan will be a tool in advocating to upper levels of government about the local needs. Each priority is supported with actions that are outlined in Appendix B of your report. Next slide, please. This work would not have been possible without the dedication of co-creators who brought their expertise and experience to inform the plan. You will see more than 40 organizations listed on the slide. I want to recognize all co-creators now, some who or were in the audience today and have been joining virtually, and we want to thank them for their work. I also want to recognize the contributions of the Social Development Center and the Lived Expertise Working Group, who have also been here today and have been a vital partner in this work. You will find the Lived Expertise Prototype report in Appendix C of the Council report in the agenda package. This work will continue with Lived Expertise Working Group to support the implementation of the plan. Next slide, please. I now would like to invite Marjorie Knight and Jen Gordon, two of our co-creator members, to share their insights as voices from the community.
I come today as someone who has lived experience of homelessness, who has become an advocate of those impacted by poverty and homelessness. I am a member of the co-creators from the community to support those who have been failed by the system created to help them. What do we think of when we say the homeless? We think of those in our count, those living rough on the streets, but these are only the ones that you see. Like an iceberg, you are only seeing the top 2% of those who are homeless. And I'm going to play with you for a moment, if you will. Bear with me. But there is a wave coming. We have been watching this wave for a long time, like tourists on a beach watching a tsunami in the distance, fascinated by it, talking about it, discussing it, but really doing nothing. This wave is growing as it is joined by waves from the lack of mental health and addiction help. It's growing from what happened during COVID, from the financialization of housing, from ending rent control, renovictions, and now the wave of those who will be unable to manage their mortgages as they wildly spin out of control. When a tsunami hits, it obliterates everything it hits, and then it spreads out over the land far and wide. But then it recedes, and it hits you all over again, destroying lives as it returns to the sea. This is my view of homelessness in this region, this province, this country. And if I have one thing to say, is that we cannot allow that to happen here. We are actually generating homelessness. If we do not stop this, the figures that say we will triple those homeless by 2028 will not even be close to that reality. We have seniors. Our elders are being priced out of their homes. Those in hospitals being discharged to the streets. I'm talking to a family of 6, one a disabled child, being told that they have to leave as the landlord needs the house for his son. After 7 years, where will they go? And you know, after 3 months of his son having this house, it's going to be flipped again for a much higher rent, which was the aim of the whole thing. I met a man who broke his back in 3 places on the job, now on CPPD. He has been living in his car for 6 months. I've met moms who slept in their car for 4 years while farming their children out to whomever could take them. Sometimes those places weren't even safe for the children. But you can't have your children living in a car with you, can you? I now have people who are working full-time, and they have a car and a gym pass. Why, do you say? Because you see, they live in their car and they have a gym pass because that way they can shower before they go to work. You work full-time, but you can't afford rent. People on ODSP and OW, people who are seniors on a fixed income, who have no chance to get somewhere to live on their incomes. Our shelter systems are full and motel rooms are limited. So what can we do? I tell you this much, it will take all of us. The co-creators has the whole community working together to put this plan in place. It now needs you to buy in, you to help us make these difficult changes. Changes of work culture, perception, especially public perception. Our only way out is to prevent homelessness, however we can. We need funds from every level of government to make this work. We need an advocacy plan to engage with other levels of government. We need to identify city and regional lines that we can build on. We need to collaborate with nonprofits and builders and those experienced in building co-ops and other affordable, or as I call it, geared to income housing. Long ago, $60,000 a year allowed you to be comfortable. Today, with $60,000, you can't even pay rent. We need to build. We need to sanction encampments, maybe even refugee-style camps. We have to find solutions, and we have to do it together. What we cannot do is wait for the tsunami to hit us. We have to get off the beach and get working together.
Hello, Council. My name is Jennifer Gordon, and I'm here as an enthusiastic co-creator of the plan. This year marks my 20-year journey in this region, working in homelessness, housing, prevention, and gender equity. My passion to try and make change has led me to support roles in nonprofit, supportive housing, systems resolution work, advocacy at a local, provincial, and national level, and university and community-based research designed to bring action and solutions to our community. Here's what I think is important for you all to know as we embrace this opportunity today for transformative systems change. In the 2022 Project Willow report, Don't Tell Them You're Homeless, there is a quote that I feel both defines the problem ahead of us today and could act as your inspiration as decision makers to champion systems change. As a lead researcher, a woman shared her story with me on a condition and with my promise to share it everywhere and with anyone and everyone who can make change, however big the opportunity, like today's decision, or small. I obliged. Her story is the barometer that I use when I advocate for intersectional gender equity in our housing and homelessness system and the other systems intersecting. Included in that is my time as a co-creator with the plan. She shared with me, some guy beat me up on the street. Yeah, I was in the hospital because of it. I died a few times. Meantime, my landlord, he got rid of everything in my apartment, and I lost my rent gear to income housing, and I ended up discharged from the hospital and driven to the shelter. While you could claim that each system did its obligations and served its purpose, the hospital kept her alive. Her market rent landlord had received her notice to end her lease, and at the end of the month, removed her things for the next tenant. Her her rent gear to income housing at the time of her violence on the street didn't have her signature. And so they couldn't confirm her commitment, and they moved on to the next person on the list as per their policy. And when she was discharged, the police drove her to the shelter, a place with a roof over her head. Alone, these systems were accountable to their policies and processes, but together they contributed to a long and unnecessary experience of homelessness, an experience that now relies on our housing and homelessness system for intervention. For me, this story is about as symbolic as it comes, but it's not unique for women in our community. In my experience, through hundreds of interviews with women at the intersections of violence and homelessness in our community, there are more stories of where systems fail than where they succeed. And often, when there are successes, it's actually despite the system, not because of it. Isn't she resilient, we'll say. But why should she have to be resilient? Resilient is a descriptor we give to justify traditional systems that are not built on or with equity, and are by design inherently rooted in magnifying the marginalization experienced by equity-owed groups. In this kind of system, we can't possibly expect anything to change. However, the plan throws this system on its head. When I was invited to the co-creator table, I came with trepidation, but I did it because of my commitment to this story and the woman who shared it with me. That I would talk to everyone who was in a position to make change, our regional government being central to that. As a macro social worker, working in advocacy and in systems, I've been part of my fair share of plans on a variety of social issues. I've seen nothing come of these plans. I've seen worse things come of these plans. I'm reminded daily that systems change is highly improbable. That is, until a system in its whole comes together in arms to acknowledge that beyond what is comfortable, beyond what is tried and beyond what is familiar, beyond what is policy and beyond what is process, that we can do better. You have 40 organizations and many more people who have weighed in through a painstaking collaborative process. These are the people that we turn to weave the social fabric that our community depends on and needs in order to thrive, to belong, to stay alive. Over the past year, these folks, myself included, have shared what they know to be true, their earned knowledge, and have expressed the solutions that they think are going to impact transformative systems change. Further, they've committed to leadership over these ideas. And they did so humbly knowing, government included, that the way we operate as a system is no longer the solution this community needs. But we can't do this without the plan. The resources attributed, the ideas attributed, the process attributed. The plan is our contract together. I want a homelessness and housing system that doesn't lead to stories like I just shared. I want a system that marks its success beyond just saved lives or just a roof over someone's head, but in how we adapt in real time, how we model and call on other systems to change, and how we address intersectionality. Because this is where human rights becomes action. This is going to be hard. It will require all of us to be moving together fluidly, but we're ready. And at the point when a system comes to you and says, we're ready to change, and further documents exactly how it plans to go about that change, that is the point in time when your decision to support the plan shifted from being a risk to being an investment.
Afternoon, Council. So I'm here to pick up where Jen and Marjorie have driven this conversation this afternoon in terms of system transformation and how the plan to end chronic homelessness before you today embeds this system transformation, housing as a human rights, and housing first principles. Next slide, please. Yeah, oh, sorry, one back. I was ahead of you. So when social housing and homelessness programs were downloaded from the province to municipalities in 1998, the region of Waterloo became the designated housing services system manager alongside 47 other service system managers across the province. In housing services, we work with partners to understand what people's housing needs and preferences are, and how we might collaborate and work together to meet those housing needs and preferences. The housing stability system includes organizations, groups, and individuals who work together to support people who are experiencing homelessness or are at risk of housing loss. The current system, as you've heard all throughout today's presentations and delegations, is not designed or adequately resourced to address the increase in the number of individuals requiring supports or the complexity of their needs. The current system of supports must evolve to address the lack of lived expertise and equity focus within all aspects of policy, decision-making, and service delivery to better align with the diverse community needs we have here in Waterloo Region. We know that what works in urban centers will not necessarily work in rural townships. One approach does not fit all. The plan seeks to address these issues, recognizes the importance of one's home community, and looks to provide supports that make sense for each individual. We need to shift our current emergency-based and reactive responses to increase attention and resources on prevention and the creation of permanent homes and homes with support. This will require a whole of community leadership across, as you've heard today, multiple systems and a robust change management approach. We need to create a healthy ecosystem that integrates systems like housing, like healthcare, in order to provide the wraparound supports that our fellow community members deserve and need. Next slide, please. Waterloo Region was one of the first communities in Canada to start using housing first philosophies and strategies back in 2007. Our community's housing programs implement the principles of housing first by providing not just housing, but housing with supports, ensuring choice and self-determination, and operating under a recovery-based orientation with no treatment preconditions to accessing housing. The United Nations Universal Declaration of Human Rights lists the fundamental rights to be universally protected. And you heard about this earlier this morning through Heather's delegation. This includes the right to housing. And Article 25 states that everyone has the right to a standard of living adequate for the health and well-being of themselves and their family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, and other lack of livelihood in circumstances that are beyond their control. Canada's National Housing Strategy is committed to taking steps towards advancing the right to housing. This national strategy and our local actions must consider the key principles of human rights-based approach in our efforts to increase access to housing. This includes the principles of non-discrimination, inclusion, participation, and accountability. Housing first and human rights approaches form an essential foundation to the 30 actions within the community's plan to end chronic homelessness that is before you today. I'll now hand things back over to Peter Sweeney.
I think there's one more slide on that. Maybe, maybe not. That's okay. I'm just gonna, oh, there we go, great. Super. So to close this out, I want to acknowledge that the region of Waterloo and this council in particular has directed unprecedented investments towards programs, supports, and capital projects to meet this community need. In 2024 alone, the region will invest more than $245 million into affordable housing and homelessness from all sources. Of this, 23% is directed to homelessness and supportive housing programs amounting to $56 million this year alone. This is a local commitment that speaks to the deep and historical commitment to the strategy of homes for all in this community. It's also a support that we cannot and will not overstate. And it is also something that you can recognize today is something that requires further investments from all levels of government, from all corners of community to ensure that we can and in fact come to a place where chronic homelessness no longer exists in Waterloo Region. Preventing, addressing, and ending chronic homelessness is a shared responsibility of all levels of government, private and not-for-profit sectors, and the community. We talk about the system, and Jen, I liked what you said, the system came here today. This is a shared community challenge that is not to be owned or solved by one order of government alone, and we are not here to suggest otherwise. We will develop an advocacy strategy to engage other levels of government, sectors, public and private partners to address the significant challenge required to address the issue of chronic homelessness. Both of these areas of work will be presented to Council in fall of 2024 as part of your 2025 budget process. And with that, I will close out this presentation with a thank you and a note of gratitude to everybody who came here today, virtually and online, to bring this plan forward. Jen, I'm gonna take another one of yours today. The idea of earned knowledge. Earned knowledge went into this plan, earned knowledge and expertise developed this. This plan is bold and it is ambitious. It will take courage and resolve to solve this issue. This is going to be an evolving experience, and we will have to adapt. It will take many, many more community conversations and changes, difficult ones and maybe some easier ones along the way. We know the importance of centering this work in lived experience. We have tried to do that here, albeit imperfectly, but we are committed to continuing down that path and doing more of it and getting better at it. Thank you to everybody who contributed to the development of this plan. And with that, I will open it up to Council for comments, questions, and feedback. Thank you.
Thank you to everyone for your presentation, for your opening and closing comments, Commissioner Sweeney. Councillor Deutschman.
Thank you, Chair Erb. Yeah, so Commissioner Sweeney, just want to direct to you. So this plan has been worked on since March 2023 or prior. And you have the theme of made in community, by community, for community. But I have to say we left out a big portion of the community in the development of this plan. And that's councillors. Councillors represent community. We represent the community, and we are the ones that have to make a decision on a substantial plan that is altering significantly the approach that is going to be taken with respect to this issue. And I'm surprised that we have not had adequate opportunity to participate in this process, like education sessions, or I think of the development of the strategic plan and the amount of time that we had as a group working collectively to develop that plan with input from everyone. So I can't support passing this plan today. I think we, as councillors, I personally believe as councillors that we need way more information. There are so many questions to be answered in putting this plan together. And I am just concerned that councillors representing the voters of the community have not had adequate opportunity to participate. And so you've left out one of the pillars of community in the development of this plan. And can you just tell me why we didn't have an opportunity to at least have education sessions on this before this was presented to us?
So through you, Chair Erb, the impetus of this plan came to Council in August of 2022 when staff were asked in an environment where the crisis of chronic homelessness was visible every single day in this community. We were asked to come back with a plan. We came back with what ultimately became the interim housing plan. And at that time, we put forward to Council an acknowledgement and seeking support and direction that unless we actually develop a full plan to end chronic homelessness across this community, we're going to continue to be reacting like we've been doing for so long. So Council at that time gave staff the direction to go out and develop the plan to end chronic homelessness. And from my perspective and my experience over the last almost 2 years, I feel that we have done that in partnership and in collaboration with the community and with Council. I've lost track how many times I've been sitting here talking about this. So I appreciate your feedback and your comment, but I believe that we have put forward exactly what we were asked to do and directed to do by this council, and the number of conversations we've had around this horseshoe through committee and council meetings and budget meetings. I honestly felt we were walking alongside with council all the way through.
And just to follow up, Chair Erb, look, we've been working collaboratively on a lot of things, and we passed a number of things at budget time that you had brought forward, and you did promise to bring forward a plan to us in April. But would you agree with me that the specifics we approved at budget time is significantly different than the general concepts that are presented in this plan? Because we don't have specifics in this plan, unlike specific actions that we approved at budget time, like the 50 cabins, like funding for certain organizations to create, for example, women's shelters or what have you. This is a completely different approach. And also, if you could answer, this is the first time I've heard the concept functional zero, and perhaps you could advise when that came up previously, and I apologize if it was in a previous document or presentation that you had given.
I'll try to keep track of there was a few questions in there. I think first and foremost, what I'd like to say is that this is not the plan of the Commissioner's Office of Community Services at the region of Waterloo. And so I realize that it's my responsibility to take questions on behalf of council. The plan that is before council today is the plan that the community here has come up with over the past year. And I don't agree that this plan is short on specifics. There are 30 very specific action items that are put before you today. I believe that this represents a path and a plan, and I believe in my experience here today, you've heard from over a dozen delegates, members of the community, people who have been part of this process to say that this is the best foot forward.
Councillor Hunick.
Thank you, Chair Erb. First of all, I have a comment and then a question. I'm quite surprised by my colleagues' comments earlier. Commissioner Sweeney, I would like to thank you so much for being accessible to the community and accessible to council. By my count, you've presented on this plan at least 5 times. I've been counting them, and it's because of you that I do know what functional zero means, and I'm very excited about this. You know that I'm prepared to endorse the plan and move it forward as it sits. And I suspect that my council colleagues know that as well, based on the clothes that I'm wearing today. My question, though, because I do have a question, is earlier today we heard from folks who are concerned about the lack of senior supports and the lack of housing supports within the plan. And I know that those things are embedded in this comprehensive document, but I wondered if you wanted to speak to those more specifically and just point the community on where to find them or how to look at them.
With your indulgence, I'll ask Chris McAvoy to talk to some of the specifics that can address your question there, Councillor Hunick, if that's okay.
Yeah, so through you, Chair Erb. Great question, Councillor Hunick. So in the document itself, recommendation or action 4.4 is a recommendation to create a senior strategy embedded within the broader plan to end chronic homelessness, and to tie it into some of the previous actions that the region, together with community partners, have taken. I would point to the fee-for-service program, or process rather, that took place last fall, and we had a community organization step forward and say, we want to move forward and create dedicated supportive housing for seniors experiencing homelessness, and staff recommended that that be funded, and that program is now being funded and being implemented by an organization in our community. So we absolutely see the connection between work that is ongoing and work upcoming in terms of working towards functional zero for specific populations like seniors, like veterans, as we work towards functional zero for all community members across Waterloo region.
Thank you, Chris. That was awesome. Just to sum up, I'm thoroughly impressed by the work of Mr. Sweeney and team and the co-creators to create such a comprehensive report in only a year and a half. I think this will be not only renowned nationally, but internationally, and I'm really proud to live in the region that has developed it. So, thanks.
Do you want to move it to get it on the floor?
Sure, Chair Herb. I would love to move the plan to end chronic homelessness.
Is there a seconder to get it on the floor? Councillor Councillor James, thank you. Okay, Councillor Foxon.
Thank you, and I look at it a little bit differently. I sometimes think the world wants the region to do everything for them. And so we try and push our staff to do that. But they're great staff, but they burn out really fast trying to stomp out a million fires. But this is community built. This is how it's supposed to be. Our leadership is to give the staff the ability to pull back the knowledgeable people to create a vision, create an action plan, and put it into process. It's not us. We're just here to listen, support, and back. And I think that's exactly what we're doing. I don't want my staff doing it all because I know they will not succeed. I know they will burn out first. But with you, with a proper plan, with action step by step, and including what you've suggested, the living, because what you want, but it comes further down in the plan. So I was just talking to your team, Peter, and I said, I can see a group that's working on the mental health and the social issues. I can see a group that's working on land and areas. I can see another group working on the housing. I can see another group drawing together the homeless people. That's what the plan is. You don't need further detail. It's in the plan. Now coming together with the people, you can make this happen. Get it done, folks, get it done.
Yeah. Well, I'm sure Councillor Foxon appreciated the applause. We'll try and limit that for the duration of the meeting. Councillor Shantz.
Thank you. Hard to follow a cheerleader. Thank you for the report and for all the work that's gone into this. The thing that struck me most when I went through the material was the number of different organizations and people that were consulted. And that's what we need to make this happen. When I was first on council, I remember sitting at a table, and I've forgotten the name of it, but it was multiple different organizations that sat around the table and specifically dealt with very specific complex social situations that crossed jurisdictions, and I was very impressed with that. And so that's how we're going to make things happen here. So I was really pleased to see that. I think if there's something that I could ask for in the next 6 months, or maybe when the budget piece comes, because that's part of the recommendation. Most of the list of actions are producing strategies, so they're not very tangible yet. I'm assuming that's all going to happen in the next 6 months, and when we get that report for budget, I'm kidding. I know it's not all going to get done in 6 months, but when we get the budget reports, that we'll be able to connect some of the financial pieces with actual physical, tangible things.
Yes, if I could, I'll ask Chris or Peter to talk specifically about some of the things that are actually underway and going to happen right away. So you know that we're not going to rest on our laurels and come back with a grand funding and advocacy strategy and not start doing this work right away. So maybe Chris, do you want to talk a little bit about just the 2024 immediate items, if you don't mind?
Yeah, more than happy to. And so I'll draw council's attention to page 110 within the report, the short-term action plan and next steps. It really outlines, so with the co-creators group, they came up with over 100 recommendations, sometimes very tangible, very specific, and other times were larger macro root system policy and systems change that oftentimes we at a local level of community we don't have necessarily control over it, but we have influence, and you heard a lot about that today in terms of the need for advocacy. And so within the short-term action plan, building on the energy and momentum today, one of the next most critical steps that we see is this all of community leadership table and work. This will take the whole of community to develop what is the senior specific strategy with older adult organizations, supportive housing organizations, health partners, and we need to replicate that again for youth, for Indigenous individuals and community members, with those actions and strategies being determined by those communities themselves. So one of the next most major steps throughout the rest of this calendar year will be developing that whole of community leadership table. The prototyping work that you've heard also about today will continue and live on and continue to be iterative and inform the process and both the strategic as well as micro actions, day-to-day actions within the community. And there are a couple of others that you'll see in that short-term action plan and next steps, but those are the two most significant ones that I would point to, is the whole of community leadership, as well as the prototyping.
Okay. Could I have just a follow-up on that? Can you speak to the touch points the council will have?
Yes, good question. Thank you. So the ones that we would be coming back regularly through committee and the budget process. If council directs us to develop some other process to further those conversations, of course, we're in your hands to do that. We've set forward this notional target of 2030. So we're looking at 6 calendar years. There were conversations around, is that too soon? Is that too far? I mean, how do you look in the mirror and go, there's an acute crisis right now and we're still going to take many, many years. Without a target, we don't have anything to aim for. And so one of the other things that would have to happen is building out the actual 5-6 year by year operational plan to go with that, including the data and evaluation component of this work that's going to be necessary so that we can keep score and know whether we're making a difference or not. And, we will embark on that process again with council. And if there's any other ways to do that in a different way that council would like us to do, we're of course open to that.
Can I just speak to that last comment a little bit? I think for me, KPIs that correspond to the topics, the focus areas, I think would be helpful. Whether it's, some of them hopefully can be numeric, and some I'm sure will be subjective, but I think that would be helpful. Thanks.
Councillor Wolf.
Through you, Councillor Erb. I'd like to congratulate staff on the collaboration and engagement of so many staff, people, and 40 co-creators to create this plan. I like the fact that you've got 31 action items, and I will tell you I have favorites. So I agree with the coalition of faith groups that mental health and a drug strategy needs to be foremost priority in the plan. I also like the fact that we're concentrating on prevention. As a teacher, I think education is extremely important, and to collaborate with the school boards, both public, high school, and university. Life skills need to be taught, economic literacy, all of that needs to be taught. Violence prevention, no means no, all of that needs to be taught to our children, our youth, very early. One aspect that I want to see in the 31 is the word women. I see it only one spot. And I know women are make up a great majority of the hidden homeless, and we know that women on the street are subject to violence. Lately, we've heard that the Kitchener Women's Shelter is closing. We yet to have a women's shelter in Cambridge, but hopefully we're getting close there. But we have no shelter right now for women and children, which we need to have. So I know in broader principles, we're addressing this, but I would like to see some specifics for women. In terms of delaying this plan, we don't have time to delay. The crisis was yesterday. We need to get as much done as soon as possible, and I'll wholeheartedly vote to support the plan and continue to work with staff and the co-creators and all the community to solve this chronic homelessness crisis.
Councillor Solomon.
Thank you very much, Chair Erb, and thank you to everyone who's been a part of this plan and who's been here to delegate today. It's been really interesting. I will be honest, though, I share some of the same concerns that Councillor Deutschmann does in terms of plopping this in front of council and not necessarily having an opportunity for further learning, and now being asked to endorse something that honestly, through reading, was a very interesting philosophical, ethical read. But there are a lot of definitions that aren't defined, even down to the human rights component. I know that Laura Pinn did send me the information that she was referring to about human rights, but even then, I mean, that was 79 pages, and I got it this morning after her presentation. I've not had time to finish going through it, but there are questions on human rights law and what we're defining in our scope of a plan. That's just one example. I'm also a bit concerned, Commissioner Sweeney, I know that you had said that back in August of 2022, Council had directed the action of this plan. I did go back and look over those minutes, and I don't see a lot of what was asked out of committee at that time reflected or at least acknowledged in this plan. I'm not saying it didn't happen, but I don't see the representation of it in the paperwork provided to us. That would include that there would be factors into the master plan that would consider a wide range of factors such as zoning, public use provisions, and area municipalities, including expenses incurred by them. Also, an emphasis that the homelessness master plan is essential to end homelessness in the region and can no longer rely on temporary solutions, yet we're talking about $110 million investment on temporary solutions going forward, aside from the operational components mentioned in the financial implications. Committee also suggested that the region engage private corporations for assistance and support. I didn't really see the reflection of that at those at the co-creator table, although please do correct me if I'm wrong. The committee also recommended that the Elmira community living model be examined for this master plan, to which this work again may have happened. I do not see it reflected in the plan, though, even that there was a discussion of it. Those are just some of the issues on the top. I'm also still confused at the fact that the plan is specifically focused on to end chronic homelessness, when what was actually passed by council was to direct staff to develop a homelessness master plan detailing the strategies and resources necessary to end homelessness in the region of Waterloo. And I do struggle with the disjoint between chronic homelessness, which has been identified, depending on who spoke this morning, either as 6 months or in the lived experience document, I believe it says up to a year, versus preventative measures, which I know are alluded to in the report. I don't see that clear definition, and I'm a bit confused how council direction even went from a master plan on homelessness to a plan to end chronic homelessness. Struggling there a bit. I also really struggle with the fact that this plan fails to identify causes of homelessness and chronic homelessness that are within control or influence of the region. I think it's really interesting and valid the structures of colonialism and imperialism and other structural barriers, including land theft, that have resulted in the problem that we see before us. However, those still aren't necessarily pinpointing the issues which were talked about in your presentation today, but not actually outlined in the plan, such as addiction, lived traumas, past life experiences. I don't understand how we can have a plan to end something if we're not actually identifying and relating back to each cause and issue. And on the seniors component, I appreciate one of the things is to create a senior strategy, but I also struggle that we're not identifying and acknowledging that that's a different problem than historically what we've seen in homelessness causes, in that many of them that's due to economic impacts. So I really think that we need to have more dive deeply into this as a council and have understanding of where you're coming from. I also found it really frustrating that there's a lot of underlying assumptions in this plan which clearly came from various sources, yet there's only 14 references at the end of the document, to which I've searched all of them amply over the weekend, and I've not found a lot of the underlying assumptions that are made in this report that I don't necessarily subscribe to because I don't understand where the points are coming from. So I would rather see a more comprehensive review of the literature and research and data. I was also a bit alarmed that it seems to be very Canadian-focused data, except for the one reference, I believe, to Cincinnati. And also, in today, you're asking us to consider a completely different political structure for how to deal with this with the community-led group. I'm not against it, but I also don't understand it, and you didn't provide the supports to the two references of the communities doing it. I've tried researching it, but it's also not amply, extensively accessible in online resources that I found to comprehend what that actually means if we're giving the power for implementing this plan to another group and different terms of reference. So those will be my general comments and feedback. I have many more if you have any, if you want to understand what's been going on in my mind, or I can send you my extensive notes. But those are my big highlights that I struggle with on this plan, and I think we're on the right step. I loved the input of the prototyping experience lived group, but I still think, honestly, this is still in its infancy and not an actual plan that by 2030, I can see any of these outcomes being resulted in.
Can I address that? Thank you. Councillor Sweeney, or Councillor Sweeney, Commissioner Sweeney.
Yes. Through you, Chair, Councillor Salonen, thank you for that feedback. I want to address two specific ones if I can. Your comment just at the end there about it's in its infancy. I necessarily wouldn't disagree with that. This is a process that is 50 years in the making, but the plan that we've put forward, even the manner in which we've had this conversation today, is new to this community. And I recognize for a lot of folks it feels different. They even feel uncomfortable. So I would agree with you there. The other point I just want to clarify is, yes, indeed, in August of 2022, we came forward with a recommendation, and that recommendation was very specifically to develop a master plan to end homelessness. Very shortly after that, we got some feedback. Feedback that the term master plan was in some perspectives and for some people harmful, colonial, and hurtful. So we changed the language immediately and going forward, and since that time, since probably September of 2022, we have consistently and constantly referred to that motion and the direction there as a plan to end chronic homelessness. So just want to make sure I clarify that piece.
May I just have a follow-up on that?
Okay.
Thank you. I can definitely appreciate that feedback and the colonial structures. I don't have an issue with the name of master. I'm curious where the focus went from homelessness as a whole, because preventative, so that people don't become chronically homelessness, I think we've all agreed and identified today is really important. I'm curious where that switch came then. I get removing the term master. I have no issue with that. I'm just curious where it went from a homeless plan to chronic homeless.
Again, that came from feedback from the community and people with direct and more earned experience than I have with respect to there is a difference between homelessness, which in large communities like ours around the world, even in places like Finland, exists. And what we're trying to get at is to ensure that any experience of homelessness is short and supported. So making sure that we address chronic homelessness, which is a challenge that communities across North America in particularly experience, was to make sure that we focused on the actual challenge that we were trying to address and not trying to focus on something that exists periodically in communities all around the world, regardless of how many resources. So again, that shift in language came from the people that we were working with and came from this process by listening to those who are closer to those with the experience that we are.
Councillor James.
Thank you, through you, Chair Erb. I'm going to preface this with some feedback, comments, and then a question, okay? I thank you for this work, and in particular those who have come here today who are on the ground in the grassroots, doing this work that many of us have no idea actually what the heck is going on right now in the community. I know that we are about to make a huge decision, and I want to see better outcomes. And that is what I struggle with, is like, how can we guarantee better outcomes? And then I recognize we need to trust this process. And as hard as it is, I know that, you all are working out in the field and working with community groups and the co-creators group. In order for me to help me understand this decision today, I had to have conversations with people who are on the ground. I had to actually speak with them and say, listen, I do not come from a lens of somebody who has experienced homelessness. I do not know how bad it is out there. What this plan does is ensure that the people who are doing the work are powerful. It's not empowering, but that the people who are doing the work are powerful in what we need to do to move forward. I do have some criticism in terms of, we're conscious of what a plan would look like, dollar figure, breaking things down all the time. That's not there. I don't think that's the intention right now. As things will come forward, we'll get more information. I'm conscious of the preventative in this, and I know we've had conversations today about mental health and addiction and looking at things from that systemic approach, and it's mentioned throughout our justice system. My question for you, Commissioner Sweeney, Dr. Sweeney, is around that preventative and ensuring that that is incorporated throughout. And I mentioned this earlier, so I'm thinking about children and youth, family and children's services that are directly seeing how homelessness is impacting children through the system. I don't see that anywhere. The justice system, and I know there's a collaboration with community justice initiatives. I'm thinking about the things that women who are leaving Grand Valley, what type of things are in place. That's part of the experience and lived experience in some of that education, but where are there barriers in the justice system, not just incarceration, but moving through after, and where we're, and I know that may come, but it's something that I want to make sure is on record, because there are elements to this that we don't know and we don't have. So from a family and children's services perspective, dealing with the youth, there's the seniors perspective as well. I do believe that there is a significant crisis that is happening with seniors in this community who are experiencing homelessness for the very first time. And I don't want to go into the qualitative research I've done, but I've had conversations with those who are barely hanging on and who are experiencing homelessness. We're just not seeing it, and that number is astronomical. And I guess I'll just end with this, and I maybe want you to respond to the family and children's services piece and where that fits in, as well as some of the justice work within the systems, if you can at this point. But I have to trust this process. I think if we do not support this right now, and there are people literally on the street that are at risk of dying right now, I think, you know, we're doing a disservice to this community. But I do know there is a huge risk for us in approving this. But it's bad out there. It's bad out there. And if not now, when? Because we can keep delaying over and over and over and over again. So I'll kind of stop there. I'll let you respond, Peter.
Thank you, Councillor James. A couple of things. I'm going to ask Peter or Chris to jump in on specifically on the prevention and the family piece. But before I do, I just want to pick up on two things that you said. I appreciate the acknowledgement or the phrase in terms of trusting the process. I want to make sure that we're not asking council to trust a process that is fully baked in concrete. This is an iterative process. I will assure you that this plan, had it been done in a different way, would look very different coming forward. Certainly, we could have brought back a plan developed fully by staff sitting in our offices, and we would have done that over a year ago. What you're seeing here is an iterative, ongoing, even the point around community leadership and a community leadership table suggests in and of itself that yes, there is a process we are following, but it's very iterative. So I just don't want you to feel, or anybody else to feel, that you're locking yourselves into something. And then before I turn it over to Peter, also just to pick up on the fiscal piece and maybe going back to Councillor Deutschman's original question, you know, one of the key things that we took from consultation and conversation with council specifically is the acknowledgement that it's exceedingly difficult to continuously be asked as a municipal government to fund social housing when we continue to be the only jurisdiction, provincial jurisdiction in the country that does so. And so you are constantly being asked to solve complex modern challenges with outdated funding mechanisms. And so one of the reasons why we did not come back with a big mid-year ask specifically from an adjustment to from a budget perspective is because you told us that. Is because you said there needs to be more levels of government and organizations and community involved in the fiscal part of this. So just as an acknowledgement of that's a very key example of how we, I believe, have deeply heard feedback from council. Don't want to be too long-winded, but I feel like I am, Councillor James, so I will get specific to your question around family and children's services, and I'll ask Peter, are you addressing this, or Chris, as in the prevention piece?
We'll speak to some of the prevention, but it is complex work, and Peter, you just said it well, that it's very formative. We started with a huge ask that soon became overwhelming on the multifaceted factors of what's required. And certainly, as the co-creator table, it started and it's building and it has been added to, and we know that we haven't got everybody there that we should have. So we recognize that, but the actions have been grouped in a way that would incorporate more of those key system service representatives coming to the table. Additionally, which would not probably be clear, is that as we were building this plan and we were identifying particularly equity sectors like developmental disability and areas of veteran homelessness and justice, we actively, while building the plan, part of the core team, have made active linkages to subsystem tables that deal with developmental groups that came together to work around veterans homelessness and a justice table. So they may not appear as strong, obviously, in this report, but there's actually work going on to develop and include more and more people around those topics. And I don't know if that's helpful, but to say that there's a lot of work and even work that has extended into action through this time.
Maybe a couple of additional points on the topic of prevention specifically, and you know, organizations like Family and Children's Services. So we know that a youth who experiences homelessness earlier in their youth is far more likely as an adult to experience homelessness on their own. So that prevention, that wraparound supports, whether it be mental health, addictions, or rental supplements for children, youth, and families, we know is incredibly important. And I would point to programs like Host Homes and Family Reconnect. There's a local Kitchener agency who works to reconnect, have dedicated staff to connect youth back with their family, to divert experiences of staying in emergency shelter or diversions from emergency or from Family and Children's Services. We then have other organizations who have dedicated beds for youth under the age of 16 experiencing homelessness. We are incredibly unique in the province and in the country in having a program that focuses on that really young youth population, because our community has seen those experiences of homelessness and those challenges. And so we as a municipal government together with partners have invested in that. I would also then point to other pieces in terms of rental supplements and rent bank as strategies that we know are effective at preventing experiences of homelessness. So we have a rent bank in our community that helps people who are having difficulty with arrears pay off those arrears to sustain that housing. Those are investments that we are committed to continuing and exploring as part of the investment plan. What does it look like to increase that? And then my final point around rental supplements. Right now within our homelessness and supportive housing unit, we have our rental supplements with paired wraparound supports from a Housing First model dedicated to those 558 individuals experiencing chronic homelessness. The resources are dedicated to those who are in the greatest depth of need, and that was created as a framework, as a strategy by our community and partners almost 10 years ago. We know that what that's not doing is addressing the inflow into chronicity. So people who are experiencing episodic homelessness, there aren't the same level of resources. So through the investment plan and strategy that we will develop with, by and for community, it will look at what does it look like to make further investments in rent bank, further investments in rental supplements, so that a youth or a family or a single adult can rapidly exit an experience of homelessness and never enter into chronicity. So those are some of the very tangible, specific things that, that we're speaking about, that we know our partners are interested in, that we hear from co-creators.
I just have one follow-up kind of comment. As I process all of what's been said today, many of us were at the Working Center lovely dinner this weekend with an organization who is also addressing our housing and our shelter crisis. And, when I think about everybody who was in that room, we had developers, we had healthcare, we had education, we had every single sector in that room. And when we talk about community approach and everybody responsibility, and I look in this space today and I see one primary sector in here, that's a problem. So as you work through this, and this is a call out to those who may watch later, that this is an everybody responsibility. The same way we show up to a dinner that costs $1,100 per table, that investment also needs to happen from every single sector as well, and including our levels of government who are also present. And again, there's one single sector in here right now advocating for this and supporting this. So thank you all for your work, and for those who showed up today and delegated, even those who wanted us to defer and had criticism. That is the way the process has to be. Everybody can't get along when it comes to making key decisions, but we have to find a common ground somehow. So I appreciate the discourse today.
Councillor Craig. And I just want to remind my colleagues that we have a time limit when we have delegates, and I have tried to keep them to that. My understanding is we also have a 5-minute timeline for councillors speaking. And we've been hitting the 6.5-minute mark so far, so maybe we can try and reduce that a bit.
Okay. Well, thank you, Mr. Chair, and I'm going to try to help you because, at my stage in life, I have to write things down in order to go into a certain process of speaking. Well, today I forgot my pen, so it's going to be a lot shorter. I'm really quite impressed by everybody, by colleagues and members of the public who have come out today to talk about an enormous issue we have, and it is enormous. The only difference between all of us are the different routes and how we want to proceed forward to get to the common goal, which is to deal with the homeless issue within the region of Waterloo. That's the only difference. My colleagues have brought up different aspects of concern that they have. I have concerns around the addiction issues within the homeless population, and all of us have certain issues where we need to have a greater fulfillment in terms of reaching that final goal. I read the document a couple of times. I agree with Councillor Deutschman. It's somewhat philosophical, but then it's from the community and it's much more freewheeling, which is fine with me. And I appreciate that. And I think it only adds to the positive direction that we are going in. I'm going to be somewhat repetitive, Mr. Chairman, over the next number of months about the fact that we will be having a meeting with our MPs and MPPs, and I specifically would like us to hand them a document of the things that the region of Waterloo needs in order to progress forward in terms of fiscal support, legislative support, and their support in terms of getting things done, in terms of homelessness, addiction, tax issues that we have. So that's where I'm heading, and we'll be repeating. And I'm hopeful we can put a document together. But I think today's discussion has been fruitful. I think it's leading us all in the direction. It's making us cohesive in a sense, because we have a common issue, overall general issue. And I think it will bring to fruition in the end a much better community. It's going to be a struggle. There's no question about it. This is not easy. And it's something that all of us have to face. And again, I come back to all the participants today that I really congratulate you on your energy and your efforts and your duration of putting up with us for this length of time. And also Commissioner Sweeney for being a brave soul. There's only one thing worse than being a politician, it's being a commissioner in terms of what you have to put up with. So I do appreciate it. And it's not an easy job, okay? And that's for all the commissioners.
Did you use 6 minutes yet?
Anyways, my time's up apparently. Thank you, Mr. Chair.
I got a pen if you need it.
You got 2 more minutes, Councillor Craig.
You have 2 more minutes.
Chair Redmond.
Thank you, and if Councillor Craig doesn't want those 2 minutes, maybe I'll take them. Colleagues, I think what we're struggling with is that this is different. And I would tell you right now, it would be a disservice to our entire community and all the participants if we were expecting perfection right off the hop. This is not one and done. How many times have we heard the word iterative today? What we have been doing isn't working. So yes, this is trust. And there isn't a defined price tag, but we know there's going to be more. And Councillor Craig, you will be getting an invitation in your inbox sometime soon to a community conversation with those other levels of government and the community, and the Association of Municipalities of Ontario are going to be there to help facilitate it, and I welcome their participation. Colleagues, sometimes as politicians, I think it's really easy to feel like Lake Athabasca. You're miles wide and inches deep. I am not an expert on homelessness and housing. I never will be. I go to experts, many of whom are in the audience, to outreach workers, to people with earned experience. We've heard academic rigor add their voice to this process. What more do we need? I cannot think of a conversation during our strategic planning where we didn't talk about the need to bring everyone along, the need to look at homelessness. We are not the experts. I would agree with Councillor Wolf and Councillor James. I too have areas where I think this looks really important and impactful to me. I'm not an expert. We have invited the experts in to help navigate our way forward. And our community are not waiting for us. Look at the very first delegation where we had Tracy, Julie, and Jen come forward and talk about this wonderful synergy that they're bringing together to help speak to pregnant women and young new parents that have nowhere to turn, and many of these are immigrants. It is very important that we lean on the expert that is being freely offered and help facilitate it. We cannot be all things to all people, but we can help facilitate the conversation. We can help the process go forward. And I, for one, think that anything less than endorsing and moving this forward is saying to the community that we're not valuing their input. This is an amazing document. This will cost millions of dollars. We've already invested millions of dollars. We have to figure out a better way to do it. I believe this community is capable of doing that. And I would also say, I want to share this good news and these strategies with everybody, because it was one of the delegations that talked about, we don't want to become a Mecca. We don't want to all of a sudden be the one jurisdiction that looks like they're getting it right, and all of a sudden people are getting bus tickets to the region of Waterloo. So let's share our expertise. Let's be very generous with what works. Let's borrow what's working in other communities and move forward in a way that will be a plan to end chronic homelessness.
Councillor Preventative.
Thank you very much, Chair Erb, and I want to begin by thanking everyone who's been involved in getting this document to this point here. All the work done by staff, especially all of the work done by the community co-creation partners, and all others who have been engaged in the process throughout. I think there's a lot of really positives in this document, not the least of which is actually having a document. As one of the people who moved the motion back in August of 2022 to bring this, to ask for this to be created, this certainly is a step, an important step in the right direction. And I think as has been said, it may not be perfect, but just like during the pandemic, we made decisions, we moved on them, and we learned from them, and then made adjustments and kept moving forward. And that's how I see this document that's before us. It's going to be iterative, and what's important is that we actually get out of the starting gate and start doing this work, building on the foundations that have been created in the past. Having said all those good things, I have to say, you know, one of the things that is disappointing has been the lack of engagement with area municipalities. When I look at the report at the beginning and I see all those partners listed, there is a big hole, a fundamental hole, quite frankly. When we did our, you know, and I'm not touting our own, but when we did our Housing for All strategy, we knew that if we're going to build trust, we needed to include the region at the table. And Ryan Pettipier sat as part of that process for the City of Kitchener's housing strategy. That has been a miss in my view on this report. And, you know, Mr. Sweeney, you said right at the beginning that trust is easily lost and hard to gain. I know Chair Redmond has talked many times about this is a all of, you know, community approach that needs to tackle these issues. Well, last I checked, the key partner, and even as you go through the recommendations in this, is the municipalities. It goes a long way to help them be part of those co-creators with you, and we heard that from several of the delegations today, and that unfortunately was a miss, and I think it's a point that Mayor Shantz raised last week. You know, there's been a few examples lately where, unfortunately, for whatever reason, the level of collaboration between our two tiers, I don't know if this is just accidental or what's happening, but it just doesn't seem to be functioning at the way it should. Having said all that, I think there are some little tweaks that to the motion that could actually help clarify some of that and clarify the desire to see some specific actions beyond strategies. And so I've circulated to the clerk and to council the following amendment. And in red are the, if the clerk can put it up, the words that are amended. It's that the Regional Municipality of Waterloo accept in principle the Plan to End Chronic Homelessness final report as the official plan to prevent, address, and end homelessness in Waterloo Region as outlined in the report this date, and that the Regional Municipality of Waterloo direct staff to be directed to add area municipalities to the co-creators group, and to be clear here, I'm talking staff, not elected politicians, to develop a detailed plan of recommendations including comprehensive funding and advocacy actions based on the plan to end chronic homelessness, and the rest of the resolution is the same. And so really what it's trying to do is recognize that this is iterative, that there is a desire to see some specific actions, and that we need to engage area municipalities. It allows it to move forward, and I would hope that council could see their way to supporting this.
So you're moving that amendment now?
Yes.
Yeah, and you're seconding it, Councillor Foxon? Okay, thank you. Procedurally, though, can we finish with the rest of the people that have listed for, okay.
We have to discuss only the amendment.
Now?
We have to discuss only the amendment.
Okay.
So comments only on the amendment.
So I have been...
Mr. Chair, just to help you along, I will hold the amendment so you can
you.
continue to have dialogue,
right,
and then I will make it.
Thank you, thank you. Councillor McCabe.
Thank you very much. And to everyone who delegated today, and especially all of those who spent so much time and energy as on the co-creators group. And it's no doubt that was a really daunting task and really challenging conversation. So I just want to thank everyone for having them, including regional staff. And I think I have to mention Lynn McCauley in this, because I don't think we should have a conversation like this without mentioning and remembering Lynn McCauley, especially in my recollection. She was one of the first Housing First advocates. So wanted to bring her name into this as well, because she had done in her time so much good work. But I just wanted to also say that I appreciate how proactive and preventative that this work is. But I did have a couple of specific questions around it. One of them is just with the advocacy strategy. I think it indicates that it's needed by the fall. I think really, given what we're talking about here, that's something that really I know staff have been doing a ton of work. But I would like to see that accelerated, right? Because I think that's really, we need to get that in place now, given how much we do need the province and the federal government at the table. So that's just one comment, if we could accelerate that. Another question I had was, one of the things I do really like about this plan to end chronic homelessness is that, I viewed the reports that we passed and the recommendations that we passed in March as kind of the bookend to this, right? Because there was a lot of policy that we changed that really feeds into this. So, I really appreciate the amazing amount of work that staff have done to put that the work that was done in March together, along with this, while you also continue to do the work in the community. So thank you for that as well. And I just wanted to also remind anyone listening, and council certainly, that there was a lot of work done in March that leads very nicely into this plan to end chronic homelessness. So, but a couple of questions. This is a fundamental change and a fundamental shift in the way that we do work. And like I asked a couple of the community partners, what does it take, or are our staff ready to do this kind of work and to fundamentally shift, and are there supports that they need in place to kind of get there, because that's a big change management piece. And then the other question I had is with the funding announcements that the federal government are sharing pre their federal budget. Are there anything do you see that are coming out through those announcements that will have some kind of impact, positively or negatively, on what we're trying to do here? And I guess my last question, just to get it all in, is it would be interesting to know, and I guess this would come through the advocacy strategy, are there specific legislative and regulatory things that we need the province and the federal government to change as well? We've done a lot of our policy changes. Are there specific things that we really need them to look at as well? Thank you.
Go ahead. I'm trying to figure out how. Councillor McCabe, thank you for all of those questions and focusing really on the future in terms of the advocacy piece. So with your indulgence, I will just sort of speak generally. Certainly, we recognize that there has to be a timeline for us to come back. We felt it was important to link the funding and the advocacy together, which is why it was worded the way it was. I think I speak for all staff that we're looking for more than, a strongly worded letter to another level of government on this. We need tangible actions, and as fast as possible. So that's the intent. The other part of your question was around the staff and how they're feeling, and are we prepared to do this? I would say, again, I'm going to take a chance to speak on behalf of my colleagues in the staff group here today. We're learning as much as you are through this process. And we also recognize we are working in and are part of a system that sometimes is frustrating. And sometimes we can even see where some of those barriers are. So I think wholeheartedly what we've brought forward today truly is a collaborative map forward that as a staff group, we are also as keenly interested and supportive of moving this forward in terms of the work, both on the advocacy side and shifting the focus of the system and where we need to invest. There was a question there about specific federal initiatives and their pre-budget tour. I don't have a specific answer for you, but certainly can, if there's something that we can get to you afterwards, we'd do that. I hope that helps.
Okay, thank you very much. Yeah, thanks.
Councillor Williams.
Thank you, through you, Chair. And thank you for everybody who came and who emailed me in advance. I really appreciated you being so available to me to answer questions, just so I could get some more information, because I am kind of a research geek and I will ask so many questions. So I'm going to try to keep it shorter today. A lot of the questions that I had have actually been answered, so that's great. So the one thing that just kind of concerns me is the financial piece, but I realize that it's a complete unknown. I always just think about how we're talking about the precariously housed, like if we're impacting our tax levy, that also puts financial stress on people who are precariously housed. And so I'm always conscientious of what kind of tax impacts we're going to be having when we come up with plans and initiatives. I really do like, though, that this one seems very flexible, and so we can pivot if we need to. So this is kind of, I guess, a theoretical question. So this initiative has so many wonderful things, and I just wonder if how much we're projecting would be enough, like especially if we didn't get any funding from upper levels of government. So do you see this as we probably can do more advocacy, or is it financially sustainable over the 6 years if we do not get any more support?
So I don't know, where that tipping point is, and I don't want to sort of guess, but a couple of things. So what we've put forward at a high level is an order of magnitude. So an order of magnitude based on what we've heard in terms of the long-term permanent housing and supportive housing needs in the ballpark of $110 million. Those are permanent solutions to address and provide increased access and stock. We've then taken the rest of the recommendations and done our best to map out and made some assumptions on when some of them would start. They wouldn't all start right away. And we get into an order of magnitude of year over year operational increases on the total what we're working on now of anywhere between $5 and $8 million. You might say, what's the difference between 5 and 8 besides 3? It's really would depend on the funding strategy and who's picking up the investment for all of those capital. If we're responsible for that and take on all the financing, it's going to be higher, more towards the $8 million. I think our goal would be to come back and say, here's what we think is true in terms of the investment required. Here's what this order of government, level of government is already doing. Here's where we believe, I don't want to sort of preempt this, because we have to have the conversations with the community too. Here's where we believe we should be making a specific ask. You heard from some delegates today talking about one of the benefits of this plan is that it can be, if we do it well and do it right, it's used as the template, it's used as the tool to have those very specific advocacy conversations with other levels of government to say, here is a map. Here is a map informed by the people who are closest to it. Here's a map informed by those who experience it. Here's our gap. And over a period of 6 years, we should then also expect, the logic would be is those investments that are currently going into dealing with the acute situation and the emergency situation logically wouldn't be required anymore. And so then where do you shift those investments? I don't have those answers for you right now, Councillor Williams, but certainly that is our intention, is to be really specific and to bring back what that return, not only on financial, but on human investment, this requires, the comment today about risk versus investment. And we will do our best, to Councillor McCabe's comment, is to have the conversations with other levels and orders of government and community. We're meeting with a whole bunch of community leaders outside of this sector next month to talk about what their role can be. And where does the role, for example, what role does philanthropy play in this strategy? That's still to be determined. So ideally, we would come back with that whole picture. Today is really about, here's what it would take on balance and on an order of magnitude. Does that help?
Yep, that's very helpful. Thank you.
You're welcome.
Councillor Liggett.
Thank you, Mr. Chair. I certainly understand where Councillor Verbanovich was going, because we each work on a strategy separate from the region. And I've got to say, for focus area number 3, we're already doing some of this. My staff is working on some of this currently, and we've been working on it since last summer. It's just not out there that we're doing it, but we are doing it. But what I want to address is what Councillors James and Salonen were talking about, that upstream preventative stuff. I'm not seeing it. I wanted to see more meat here, in particular to do with the youth strategy. Currently, you know, when we're looking at this, it seems that we're only talking about teenagers and keeping them off the streets and in homes and that. But it happens well before that. By this time, it's already too late. We have Children and Family Youth Services through the province. They're totally underfunded. And when you have you know, they're the frontline workers, and yet they're not. The burnout from them and the post-traumatic stress syndrome is terrible. The number of those people leaving the industry is really horrific. So we're going to be seeing a domino effect that's even worse than what we've got now. When they're being told not to open files because they might be considered racist or biased, and they leave kids in unsafe places. And when we see workers being told you can't go above a 2% ask because you'll bankrupt Children's Aid, but yet you have an executive director that gets a 25% increase, that's horrible. That's demoralizing for those people who are our frontline workers that are going to be preventative for 10 years down the road. So when I look at this, I'm not seeing the younger kids. Yes, it talks about the teenagers here, and we see them running off to the encampments. We see them unknowingly putting themselves at risk. But where's our partnership? Who are we partnering with to prevent it from getting to that point? Because it's really bad, really, really bad. That's...
Certainly, through you, Chair. Just again, high level, a comment you heard earlier was that the original list from the co-creators was almost 100. We also have the additional calls to action from our colleagues in the prototyping. So there was an element of trying to capture granularity and system thinking in some of this. Again, going back to, this is part of the conversation. This is part of the engagement with council to say, I've heard a few times, don't forget further upstream with families and children. You know, so there's 3 specific in focus area 5. We acknowledge that we have to focus on prevention. It is a key pillar of this work. The next step is, how are we going to organize ourselves? How are we going to prioritize this? And oh, by the way, what did we hear from council in terms of what might be missing that, you know, as we're bringing things back? And so that would be a perfect example of how we're trying to take your feedback to make this better.
Just a follow-up comment. Yes, I did ask for that in the very beginning when we started this process, for them to be brought to the table as partners, but I'm not I'm not seeing that. I'm not hearing it. It's not in any of the documents. So I'm really disappointed. I hear Councillor Deutschmann, you know, and Councillor Salonen for the bravery that she had in the comments that she was making, because that's a very hard thing to say out loud. And I certainly appreciate, you know, her comments. It's just for me, it's just not here. I wanted to see more. I was hoping for more. So, I mean, this is good, but we got more serious problems coming. And that's what I'm trying to prevent, or at least play a part in solving.
Okay, we are now starting the second round of speakers. Councillor Deutschmann.
Thank you, Chair Erb. First of all, I just want to echo Councillor Craig's sentiment that, you know, we're all going to the same place, but just suggesting different ways of getting there. The discussions, comments, and questions, I think, demonstrate how much we as counselors want to learn before making such a substantial decision. And no one's expecting perfection. No, didn't hear that from anyone, certainly not coming from myself. I've heard about having conversation and input, and I don't think it's disrespectful to any community groups and members that have participated to ask questions as the elected decision makers of the community. We're the elected representatives that have to make the final decision with the help of the experts. And the education, hopefully going forward, there will be some consideration to providing education seminars so that those that want to ask more questions, detailed questions, will have that opportunity. I know we're doing one on drug strategy coming up, and I know Commissioner Rose has provided that opportunity in the past as well. My community town halls are geared to engaging the community and having community discussions with experts to better inform the community on issues like homelessness, rent evictions, drug strategy, and intimate partner violence. So just a couple of questions, like the input that I would have liked to have had perhaps would have been, for example, on the definition of functional homelessness. So, there are multiple definitions of functional homelessness out there, not just the one that has been adopted in our plan. Further, whether we wanted to have a 6-year plan or not. Now, one of the questions I do have, which I would like to hear about, is if we adopt this plan and, the reference to the human rights approach, will that affect the area municipalities regarding evictions of encampments? And I know, for example, there's a court case involving the city of Cambridge. So what implication would that have in relation to that? That's just a question that I had a concern about.
Graham, did you get that question? I wasn't.
I believe so. Councillor, if you could just specifically on the question, just zero in for me. I'm happy to take a look at it.
Yeah. So, we talked about, there was reference to the human rights approach, some questions earlier about whether that meant UN human rights, the Valente decision, for example, and what does that mean? And the lived experience group in their action items, refer to these sorts of issues. And so I was just wondering, what are we committing ourselves to when we say we're adopting a human rights approach and an area municipality mayor supports this document?
So through you, Mr. Chair, Councillor Deutschman, I suggest that the term human rights has a broader, normal, ordinary meaning that would refer to, the wide range of topics that you discussed. In legal terms, typically when we refer to human rights law in the province of Ontario, we're referring to Ontario provincial legislation that specifically guarantees human rights. The Human Rights Code, of course, being the primary source of legislation. There are a few others that afford something akin to human rights as well. Happy to delve further into that, but I gather, and I'll defer to Commissioner Sweeney on this, that I believe the term is more used in the broader general sense as opposed to the specific legal meaning, but that broader general sense would also include a specific legal purpose for Ontario.
If I may, I just had a concern because there was reference to the charter in Valente when we were talking about a human rights approach. So in the discussion, on the public discussion on this item.
Through you, Mr. Chair, I would suggest probably the charter would be included in that as well. Councillor George, I would agree in any reference to human rights law for sure.
Okay, thank you. Thank you, Mr. Chair. Those are all my comments. Thank you.
Point of order on that, Mr. Chair, and I think that the context that Councillor Deutschman was referencing is the commitments that have been made, that Canada has made at the United Nations in this regard, and that's what is the basis of the human rights concept that's being talked about here.
Just on that point, sorry, Councillor Vanovic, but we did specifically reference, and Dr. Pinn did reference as well, the Valente decision. So I'm just, again, look, I don't have to deal with it at the area municipality level. If you're satisfied, I'm satisfied, not a problem.
Councillor Hunick.
Thank you. The PECH represents a year and a half of dedicated research, as well as many, many more years of earned knowledge. And we can ask for research and outcomes data until cows come home, as people that live above, if not far above, the poverty line. But the people that are on the streets right now are not asking those questions. They're asking, do I matter? And if I matter, why don't I have a safe place to live and sleep? And so a wise colleague of mine once said, we can't expect perfection. And I think that's true. And another wise colleague of mine once said, guys, it's bad out there, and we gotta do something. So can we do this now, please?
Councillor James?
It's a question for clarification for Commissioner Sweeney. I'm conscious of the working collaboratively with area municipalities. Can you speak to any involvement that has happened with area municipalities at all? Like, if there's no communication with that? I mean, I've been at some lived experience groups and there's been staff there, but I just want you to speak to this because it continues to come up and I want clarity around this.
Yes, certainly. Actually, I'm going to ask Peter Phillips to talk about, as our project lead, some of the specific efforts to answer the specific, but in general, you know, we acknowledge, and my count, there are six of the action items specifically recommend the interdependency of the relationship between the region of Waterloo and our area municipal partners, and specifically even further around some of the differences, as Chris referenced, the differences in challenges and potential solutions in urban settings versus rural settings. We have regular conversations. We have a housing and homelessness leads conversation, which is just staff. I do acknowledge that the co-creators table, as it was established, was a group of people who came from organizations, specific service agencies, and agencies adjacent to the delivery of service. And so engaging with our municipal partners, both at an elected level and at a staff level, look differently throughout this entire process. I also acknowledge that going forward, I mean, part of our advocacy strategy, I would suggest, like one of the requests I will have to our councillors around the table who also wear hats as mayors is, you know, can we have the opportunity to come and actually talk to your council? Can we have this conversation? Can we bring this? You know, those are the types of conversations we have to have. And certainly you've heard the community leadership table, which is to be developed, but is in concept and recognizing system change. Our area municipal partners, both at a staff and a political level, have to be active and willing participants of that and fully acknowledge that that needs to be the case. So I would say that would be my response to that. If you're looking for specifics, Peter can talk a little bit about some of those, the ways that we have had those conversations, if that would help, Councillor James.
Yeah, I think this requires just more of a little deep dive here because, again, I'm noticing the pattern and the trend, and I want clarity because if there is a flaw in process or something that needs to be reevaluated, that needs to get, you know, addressed as we approve this at the upfront. Otherwise, I'm conscious that this may continue to come up over and over and over and over again and then delay processes and delay the work that you all need to do. So, yes, Peter, if you could please do a deep dive on this. Thank you.
Thank you. It has been a journey. We did this plan in about 11 months, and so that sounds like a lot of time, but we were really starting from a very small beginning. And so whether the decisions were the right or not, but we knew that to engage community, we wanted to invite people with lived experience, we wanted to invite equity groups, and community service providers, the core of the work. And so we have formatively built the process, recognizing, and we heard from particularly lived experts and some equity members that it was a bit of a scary thing to bring the power systems into a room and to meet and to talk openly. So we have tried to build that trust as a regional staff with our community group. And so that's been the journey of building trust, the building of having conversations as a community, albeit with the region in the room. And that was a growth journey. I remember almost a year ago, April 4th, standing here with Alex Petrovich from the SDC, who said, this is different, this is a change. We're coming together here with lived experts to work with the region. So that's maybe a rambling answer to say, we've recognized that when you look at our systems diagram, that our area municipalities are key partners. I think it's just been an additive process of the journey. And when you look at the plan, it is clearly referenced throughout albeit not with the specifics, because I think that is where the dialogue needs to come. What are the appropriate roles and responsibilities that area municipalities can speak into the development of the plan? And so we did in the summer, last summer, offer engagement opportunities with all councils. We offered to the CAOs of all area municipalities opportunities for our engagement team to come and meet with staff. Some responded, the same with townships. We have met with the municipal leads group, I think as recent as, I'm going to do this in December, no, in March. There have been, and probably not to the degree that what I hear is wanted, but it's been that journey of adding and including. And so I think, as Peter has given a great answer, is that that's the work that we need to do to find the right fit, the right role, the right responsibility of how we bring all of those systems together.
All right, thank you very much for clarifying.
Councillor Foxon.
Thank you. Again, I think this is great, Peter, and I think that we could punch a million holes into everything we wanted to do and every motion we ever pass. But at some point, this is a fluid document. I call this a fluid document as this is. It grows and evolves, and there's going to be steps along the way where you've got to pause and deal with an issue and move on. But that's how governance works. It's not, oh, let's vote on this, it's perfect, and it stays perfect, because we know nothing stays perfect. So this is I don't even think it's a leap of faith, because too many great people are backing it. I think this has to happen because, and it has to be now, because if it doesn't, shame on us. I really think shame on us if this doesn't go forward. It will evolve, it will deal with the punches as they come, and it will move forward and evolve to even be better. Thank you.
Councillor Solomon.
Thanks. Sorry, I just want a clarification because I have been asking my CAO what engagement we've had with this plan. She has said we haven't had any formal invitations, as well as I know I would have invited you to speak at my council had that offer been there. Can you clarify at some point where that information, how that outreach happened, also why it didn't go to heads of council, as technically we'd have to be the ones to invite you? And I know we know how to do it because we had Commissioner Sweeney come out and talk about Herbs Road to my council. Bit confused on that.
It was through email in June. An email went out, I think, from Peter and the Director of Housing to the CAOs, and we offered opportunities for staff engagement at that time. So that was the time.
Okay, I'll follow up on that. Thank you. I would still ask my colleagues, and it's not that I want to stop the plan or the important work here, but I do think there are a lot of valid questions that have been raised just for curiosity and inquiry, so we understand what we're actually voting on and what we are endorsing. I think that that experience for this, at least for myself, and I know some other councillors have asked, we want the opportunity to understand where you're coming from, to understand the background information and knowledge and research. I appreciate, Chair Redmond, we're not professionals in this, but I do think it is our responsibility as representatives of our community that when somebody asks me, so tell me about the plan to end chronic homelessness, I can say where that information came from. I can confidently explain the ideologies that went into it and what it's going to achieve. At this point in time, I'm not able to do that for reasons that I already explained prior. I would appreciate the opportunity, even in the next week or so, to be able to sit down with your team and to better understand and ask questions that I really do think are important, that we should be asking and considering and understanding, especially when we're being asked to completely change a power dynamic. And like I said, I'm not against it, but we need to understand it before we just vote on it saying that, you know, we really need to do this. And Councillor Hunick, I certainly understand where you're coming from, that people on the streets right now living rough are going through experiences which fortunately none of us around this horseshoe, to my knowledge, have ever had to experience. At the same time, I don't want to just approve something for the sake of being able to say we did something. I want us to be able to fully understand the background and what it is that we're approving and how it's going to help those individual people. I don't think a week's difference is really going to change, as it's not like we aren't currently doing anything. We have very extensive programs which we have continued to invest heavily into. That would be my request.
Councillor Liggett.
Thank you again, Mr. Chair. I would like I'd like a confirmation or at least the question that Councillor James had asked the delegate, which really didn't answer the question as to the consultation with the area municipalities, because it was never brought to me for it to be put on the agenda. And I noticed you'd put your mic on to speak to that and never got the chance to do that. So can you explain how that process, either how it fell through the cracks or didn't fall through the cracks? Maybe I just am not cognizant.
Oh, I think you're cognizant. I think I might have confused council. My reference to the opportunity to come before your council, I was thinking a future opportunity. There was no specific request through any heads of council in this process to bring this plan, because there was nothing to bring. We did have, I believe, I'm going from memory here, there was an all-council meeting back in the summer or fall. We made sure we were out there to connect with councillors as they were coming in, and acknowledging that's a pretty informal piece. I can tell you that, you know, the invitations to CAOs from a staff-to-staff level, and the plan to end chronic homelessness is constantly on the housing and homelessness leads conversation. It's not lost to me, however, that the feedback is the feedback, and you know, going forward, you know, again, this is not an iterative process. This is not a process you're stuck with. The degree to which we partner, like truly partner and collaborate with our area municipalities and all of our community partners and our lived experts, is crucial to this piece going forward. So just to be clear, my reference to an invitation to come to your council, that was me sort of being preemptive to say, we'd love to come in and talk to your council if that would be something you would find helpful at the right and appropriate time.
Thank you.
I'm sorry for any confusion I caused there. That was from me.
Thank you, Commissioner Sweeney. Yeah, I just want it clarified here, because when the delegate here is talking about working with the area municipalities, it's not with the municipalities, the governance of it, it's with groups throughout the region that may or may not be connected to the city hall itself or politicians within the city. So there's a disconnect there, and I see that here, and I think that's what, I don't want to put words in Councillor Urbanovich's mouth here, but I think that's probably where the direction that he was going there too. Thank you.
There are no more names on the screen. Councillor Urbanovic.
Thank you, Mr. Chair, and great discussion and debate amongst our colleagues. So I will move my amendment with some slight tweaking to the original motion, and it's been seconded by Councillor Foxon. And just to be very clear, the intent of this amendment is to recognize that there's been a lot of amazing work that has been done, and we need to move forward with it. It may not be perfect, but it's an incredibly strong start. And what we heard tonight is, or like, it's not night yet. What we heard this afternoon feels like it might be soon. What we heard today is a desire to see some more specifics around actions, and also the desire to engage with area municipalities at the staff level, and if that includes the council level as well, that'll be I certainly would take up Mr. Sweeney on his offer, and I'm sure some of my other colleagues, if not all of them, probably would as well. And so I think what it simply does is makes it clear in the motion that these are things that we're looking to come back to us, but certainly it's not slowing down or stopping any work in the meantime.
Thank you. Do you want this read again, Councillor Hunick? No, I got it. You're okay? Okay. So I have a question, if I may, on the amendment. Accepting in principle is no different than adopting for council or for staff to move ahead with the process. Is that understood and clear?
So if you're asking me in terms of the intent of it, so that the minutes can reflect it, is that the work can be done, but there's a recognition that there's some additional information that we're looking for, and that's referenced later on in the motion.
Fair. Good. Thank you. If I may have a minute or two, everyone else has had an opportunity to express their appreciation to staff and to the community folks who have participated in this. And so I want to say thank you for engaging in a very difficult conversation. I know some of the conversations around the table were difficult. The initiative that staff have taken to invite you back to the table, the conversations are going to be equally difficult there, but we know that's the only way we're going to get everybody at the table and have an outcome that's equitable and fair to everybody in the community. It's been a diverse group that has met, and because of that diversity, I think the content of this report is much, much better. Over time, the plan's going to see a significant shift from how we allocate our resources from what sometimes seems like a patchwork of temporary solutions to something more permanent. And for me, it's like we're finally taking the bandage off the wound and working towards a cure that will hopefully require no more bandages and instead provide safe and stable housing. And it's been mentioned earlier by my colleagues, and it needs to be continually reinforced, that this unprecedented collaboration with over 40 community groups needs to be held up to the provincial and federal governments as a community model that has come together and developed a comprehensive plan that is certainly, it's not a quick fix, but is focused on a visionary long-term game plan to solve the homelessness crisis. And with this plan, they need to come to the table to support us, because we can't do it alone. It's not our responsibility to do it alone, and they need to be there to help us. And at the end of the day, the unsaved dollars in implementing this plan will far exceed the work of what has happened. So thanks again to staff, particularly Peter Phillips, for leading this conversation, to the people in the community that were part of it. And thanks so much for hoping that we're going to see some significant changes by the year 2013 or 2030. Going backwards. Anyway, we have an amendment. It's before you on your screens. Councillor Hunick, you know what we're voting on. You use your e-scribe buttons to indicate your support. Councillor McCabe, are you still online? You want to vote with it by show of hands? Oh, we just got it. Thank you. That's carried. Thank you. All right. Now, so we're a little bit ahead.
Point of order. I think you need to do the main motion as amended now.
Okay. Excuse me. Yep. So the main motion now is amended. Again, use your e-scribe buttons.
It'll just take Aaron a second.
Pardon?
It'll just take Aaron a second to get that vote
Okay.
ready.
Okay. We'll just need a second to get this queued up.
My hand's up. I'm voting in favor.
We got it.
Thank you.
Okay, that's every. And that's carried. Thank you. Thank you for those in the audience for your patience in being here with us for the duration of the conversation. So we are a bit ahead of what we were planning for 4 o'clock, so we'll continue to go through with, and we'll continue with this, okay. On to 7.2, equitable services and opportunities, creating culturally responsive, not-for-profit childcare spaces. Barb?
Mr. Chair.
The childcare.
Mr. Chair.
You gotta finish childcare.
Jim, Mr. Chair. Sorry, I'm not trying to be difficult, but I am really concerned that we've got a number of significant issues that we're talking about in caucus today, and I'm just concerned that some of our colleagues have indicated that they need to leave. And if we go into this and other things, like we've probably got at least 2 hours worth of caucus. Can this not wait until council day and start at 4 o'clock on council day?
I was just going to try and finish community and health services, which is the last item on the agenda.
Okay.
Go ahead. Yeah. Go.
Okay, I'll go really fast.
Go ahead.
So Children's Services report called Creating Culturally Responsive Nonprofit Childcare Spaces. In this report, we are asking and recommending that council direct staff to explore opportunities and identify nonprofit organizations to lease 30 Christopher Drive in Cambridge and 104 Sterling Avenue South in Kitchener, to create culturally responsive childcare for Indigenous children and families and other families that face systemic barriers. If we do this work, we will be able to take one small step in advancing our responsibility to respond to the Truth and Reconciliation Commission's calls to action number 3, number 5, and number 12, along with the United Nations Declaration on the Rights of Indigenous People, Article 14, 21, and Missing and Murdered Indigenous Women and Girls, Calls to Justice. And we will be, in so doing, we will be developing culturally responsive care for First Nations, Inuit, and Métis families. We have been undertaking consultations with Indigenous community members and community organizations on creating culturally safe and relevant licensed childcare spaces. High quality, safe, and culturally specific licensed childcare programs will provide connection to culture and Indigenous ways of knowing to support healing and education of Indigenous children and families. And these will represent our very first childcare programs that are led by Indigenous organizations. I'm here to answer questions, receive comments or concerns.
Chair.
Okay. Councillor Hunick.
Hi, Barb.
Hi.
I'm in favor of Indigenous childcare, most certainly, but if I understand correctly, the region got out of childcare in 2014. So can you just clarify for me for 1 second how this is different from that and how we're not stepping backwards into what was problematic before?
So yes, thank you for asking. These programs would be operated by the Indigenous organizations. So it would be a program that is owned and operated. They would just be leasing the space from the region. You're welcome. Oh, could I just say one more thing that's very different is Indigenous-led childcare looks very, very different from I'll call mainstream childcare. And so it is not the same thing as a mainstream childcare center either. It would be run by Indigenous folks with Indigenous staff for Indigenous families.
That's wonderful. I'm so excited that the region is going to have that. That's going to be so great.
Thank you.
Chair, I'm willing to move that if, oh, good, good.
There's 3 more speakers, and council members committee members are expressing some urgency to get to close, so I'm at your pleasure. Keep moving. Okay, Councillor Liggett.
Thank you, Mr. Chair. I understand there are quite a few different early childhood education groups who had asked to lease this space from us, and yet we're going this direction. So are they going to be, is this only going to be for Indigenous children, or are they going to accept other children? And how many other organizations had asked for this? And do we have space available in the region for the other groups, or like the other children that are in need of daycare?
So we, as you know, we're in the midst of massive childcare growth. We've grown by 960 spaces already since 2022, and we have we are on track to produce another 1,400 childcare spaces. These will represent 92 of the 1,400 spaces that are remaining. We are in the process, as went forward in another report, of identifying surplus property that is owned by the region or surplus spaces. We're also working with area municipalities and other publicly funded organizations to identify space in other buildings where childcare might be able to be provided. And childcare operators, we will have an open and transparent process for any of the spaces that we control for inviting applications of interest from childcare operators to run programs in those spaces. In answer to your question about will other non-Indigenous children be welcome to attend, it will be up to the organizations that operate the childcare programs, but typically Indigenous-led programs are open first and prioritized first for Indigenous children to address the barrier that those children have experienced in the childcare system. And typically, if they have spaces remaining, once they have filled with Indigenous children, they will typically open up to other children as well who are not Indigenous.
Follow up to that, please, Mr. Chair?
Yes, go ahead, sorry.
Thank you. So it's fine that the report is coming to us in other regionally owned buildings. Do we have an idea of how many of those buildings will be able to be utilized for daycare? And if it's minimal, are we going to be creating more, or are we just going to have this big long? My concern is my earlier conversation about children that are at risk because they don't have proper family homes or child care. I just see that as this as being part of the problem. So I just want you to reassure me.
Yes.
Maybe you can't at this point, but.
So you will be familiar with our access and inclusion plan, which we had sent a message out to council with a link to it. And it is working on addressing access for children who are living with low income. And I think that's what you're speaking about. We have about 20 childcare operators right now.
No, I need to
Okay.
stop you because children at risk has nothing to do with an income level. Children at risk could be from extremely wealthy families.
Absolutely. So the priorities would include children who are at risk and have special needs or social needs as well. So children, I thought you had said living in poverty, children who are at risk because they live in poverty, children who are Black, Indigenous, or racialized because they historically experience significant barriers that white upper-class families tend not to experience, and children with special needs and children with social needs are included as other groups that experience barriers. And so our access and inclusion plan is focused, and there's 16 actions within that is focused on ensuring that the children I just listed have equitable access. The goal is to get enough spaces to meet demand. The problem in this moment is there are not enough spaces. And so we're in this space of scarcity, and everybody who needs childcare. And it is certainly a challenging time. I should add that the region is not solely responsible for finding space where they can create childcare. It is up to the childcare operators as well, and they actively are pursuing space themselves. We have just taken this step to help supplement that because they have identified it's really hard to find affordable space. Thanks.
Councillor Deutschman.
Thank you, Chair Erb. Just briefly, 104 Sterling, is that a standalone or is there other services at that facility? Is that the Edith McIntosh facility?
Yes, it is. It's the former Edith McIntosh Children's Centers, and it's on the property beside Cameron Heights High School.
Okay, thank you.
Councillor Urbanovic.
Yeah, thank you very much, and thanks for staff for bringing the report back. I will support it. I think it sounds like a great idea, but I do just want to note that as the region had to do with the other issues, there will need to be an indemnification with the city as the city owns the land, and that's not reflected in the report. Thanks.
Okay. Yeah, just for the record, I'll acknowledge that, yes, literally as you started talking, I was like, oh yeah, we have to make sure that, so we'll make sure it's reflected in anything coming forward in any plan. We've got some time to work our way through this in terms of timing. It's currently being used, as you know, but yes, we'll make sure that that's all tidied up. Thank you.
So this is moved by Councillor Foxton, seconded by Councillor Craig. If there's no more discussion, would you please use your e-scribe to vote? And Councillor McCabe, are you still there?
I'm in favor. Thank you.
Yes, okay. Thank you, that's carried. 8.1, Council Committee Tracking List for Information, Written Correspondence.
Chair Erb?
Yes?
I just would like to have added to the tracking list. Commissioner Sweeney will recall I asked about a home where a couple was moved to through the path, and I'd sent him a link to the news story article about that. So I would like to have that added to the tracking list for an update.
Thank you. So noted. Written correspondence from Barbara Hill, Adam Kressler, and Kathy Barish for Council's information. Is there any other business? Our next meeting is May the 7th, 24. And I'd like to have a motion to go into close. We now start a vote to go into closed. If somebody could. Sorry, you just have to note that. Please note that an additional. Oh, yeah, I'm sorry. And we have to please note that an additional item has been added regarding personnel matters related to an identifiable individual. Is there a mover and a seconder? Moved by Councillor Wolf, seconded by Councillor Solonen. If you use your e-scribe to vote, please.
Voting.
Thank you. Need a motion to, oh, well, wait. Yeah. That's carried. Thank you. A motion to adjourn, moved by Chair Redmond, seconded by Councillor Schatz. Use your e-scribe to vote, please. We have unanimous consent. We'll see you downstairs.